Good evening, everyone. Once again, welcome back to the presentation series presented by Team Ayurapta, and I welcome you all to Tarangini, a national level seminar with paper and poster presentation. So, first of all, I would like to welcome our respected faculty members. And now now I would like to invite our each one participant, and without further add-on, we can start the presentation. And the presentation is live on YouTube channel, so please don't unmute unnecessarily yourself. And dear participants, the panel strictly reminds the duration of your presentation. The maximum time allotted for your presentation is 8 minutes. Kindly do follow the time limit. And I wish all the very best to our participants. So first, I would like to invite
Dr. Jayanth BS for the paper presentation on the topic examination of head injury.
Good evening to one and all. Myself, Dr. Jayan, second year PG scholar, Department of Shalyatantra, Sri Kalabareshwar Ayurvedic Medical College, Bangalore. Welcome to the Tarangini National Seminar paper presentation of May 2003. My topic is examination of head injury under the guidance of Dr. Vishwanath sir and Dr. Shailaja ma'am, Department of Shalyatantra, Sri Kalabareshwar Ayurvedic Medical College, Bangalore. Content: Introduction, history taking, physical examination, types of head injury, classification of head injury, signs and symptoms, differential diagnosis, investigation, management, complication, conclusion. Introduction. Head injury are damage to the scalp, skull, or a brain caused by trauma. When it affects the brain, they were called as traumatic brain injury. Brain and spinal cord injury may result in a major physical and psychological dysfunction and can alter the patient's life completely. The most people head injury are considered an acceptable risk when engaging in sports and other types of recreational activity, but they were dangerous. They can lead to the permanent disability, mental impairment, and even death. History taking. Causes for head injury. Example, road traffic accident, HTN, diabetes mellitus, renal disease, uremia, poison, ethanol abuse. This history collected from the witness or attendant. We have to rule out whether the patient become unconscious immediately or after some time. If we know the duration, it helps to assess the nature of injury. Occurs immediately, concussion, secondary compression. Patient remains consciousness but becomes comatose. It indicates the damage to the middle meningeal vessels. We should ask for fits or vomiting. Vomiting indicates the signs of recovery from cerebral concussion. Physical examination. First, we have to see the bleeding from the scalp. It must controlled immediately and look for lacerated wound, abrasion, and fracture. Check the vital functions like BP, pulse, respiratory rate. If vomit and fits is there, the patient should turn to the left lateral position to prevent the aspiration of vomitus or a blood. Patient is an adequate airway. If he is not breathing well, we have to use a mouth gag or a tongue should be pulled out. Look for a fits. It is unilateral. It is due to the middle meningeal hemorrhage. If it is bilateral, hemorrhage from the superior longitudinal sinuses. Position of patient. He is lying placid with his jaw relaxed. It is serious. Suppose curl upon his side. It's due to cerebral irritation. Depth of consciousness. It is determination by calling his name, applying the pressure on supraorbital region, pressure over the manubrium sternum, pricking finger, tip and pinching. Eyes. Look for subconjunctival hemorrhage and black eye. Pupil. In cerebral concussion, pupil slightly dilated, equal react to light. First stage, injury side, the pupil will contract due to the irritation of third cranial nerve, whereas other side, the pupil remains normal. Second stage, pupil of injury side dilates due to the paralysis of third cranial nerve, whereas other side, the pupil will contract due to the irritability of nerve. Finally, both sides of pupil dilated and fixed. In pontine hemorrhage, people will be pinpoint and fixed. Bleeding from nose, ear, mouth. Nose bleeding indicates a fracture of anterior cranial fossa. Mouth and ear bleeding indicates middle cranial fossa. Battle sign. We can see the patchy ecchymosis appear near the tip of the mastoid process within 3 to 4 days due to fracture of posterior cranial fossa beyond the foramen magnum. Pulse and BP. In concussion, the pulse is rapid and thready and BP falls. Pulse becomes slow and bounding and BP rise of intracranial pressure. Temperature. In concussion, temperature is subnormal. In intracranial hemorrhage, rise above 101 degree. In pontine hemorrhage, more than 108 degree. Respiration. In concussion, respiration is slow and shallow. In cerebral compression, the respiration becomes slow and deep, whereas in rise of intracranial pressure, respiration becomes slow and deep. Rhythm becomes irregular. Chain stroke. It is due to the obstruction of airway by relax of soft palate and falling back of tongue. Power of limbs and reflexes. Looks for spontaneous movements of limbs. Paralyzed part lies motionless, tested by painful stimuli. Power is elicited moving the joints against a resistance. Muscle strength grade as follows. Grade 0, no visible muscle contraction. Grade 1, visible muscle contraction with no or trace movement. Grade 2, limb movement but not against gravity. Grade 3, movement against gravity but not resistance. Grade 4, movement against at least some resistance supplied by the examiner. Grade 5, full strength of muscle. Reflexes. 3 types: superficial reflex, deep or tendon reflex, organic reflex. Rigidity of neck. It is present in subarachnoid hemorrhage due to the irritation of meninges by blood give rise to rigidity neck with fever. Cranial nerve. In unconsciousness patient, only few of them can be examined. If squint is there, indicates the third, fourth, and sixth cranial nerve involved in the head injury. Types of head injuries. Concussion, contusion, hemorrhagic injury, open head injury, closed head injury, can be focal or diffuse. Classification of head injury. Injury to the scalp may be open wound or closed. Example, hematoma, subcutaneous, subaponeurotic, and subpericranial. Injury to the wallet of scalp, compound fracture and simple fracture, fissure fracture, and depressed fracture. Injury to the base of skull, anterior, middle, and posterior fracture. Injury to the cranial nerve. Injury to the brain, cerebral concussion, cerebral contusion, causing cerebral irritation, give rise to the cerebral compression. Injury to the blood vessels, middle meningeal and subdural hemorrhage. Injury to the dura mater, it associated with injury to the scalp and skull. Injury to the blood vessels caused by the cerebral compression, leading to the deterioration in the level of consciousness and impending the danger of death. Escape of CSF. It is designed due to the fracture of anterior and middle cranial through nose, mouth, and ear. Signs and symptoms. Dilated pupils, change in the behavior such as irritability or confusion, trouble in walking or speaking. Drainage of bloody or clear fluid from the ear or a nose or vomiting and seizures. Weakness or numbness in arms and legs. Differential diagnosis. Fracture of base of skull. Fracture of anterior cranial fossa. Escapes of cranial contents occur through the nose. Cribric plate is broken. Orbit roof is involved. Nerve first, third, and fourth, first division of fifth and sixth. Fracture of middle cranial fossa. Escapes of cranial contents occur through the ear, mouth. There may be bleeding from the nose if the nasal sinus is involved. Nerve affected the 7th nerve commonly and 8th nerve sometimes. Fracture of posterior cranial fossa. Extravasation of blood occurs to the posterior mastoid or in sub-occipital region. The 9th, 10th, and 11th nerve are occasionally affected at the jugular foramen. Cerebral injury. Concussion. The patient will be in shock and it developed immediately after trauma. Here the patient becomes unconscious for a short period, which follows by the complete and perfect recovery. Pulse increased with a low volume, blood pressure low, respiration quick and shallow, temperature is subnormal, muscles flaccid. Cerebral contusion. Bruise on the actual brain itself is called as contusion. It can cause bleeding and swelling. Intracranial hematoma. This is a bleeding under the skull in the brain that forms a clot. Brain hematomas range from mild to severe and are grouped according to where they form. Cerebral laceration. Here the brain surface is torn with a effusion of blood into the CSF, leading to the subarachnoid hemorrhage. It is caused by the injury of brain surface against the bony ridges and the edge of the dural septa. It is a common on inner aspect of hemisphere under the surface of frontal lobe and tip of temporal lobe. Patients suffer from anosmia and change in personality. This may occur on opposite side to the site of impact. This is called as countercop injury. Cerebral irritation. It is developed about 3 days after the injury due to the cerebral edema. Patient is not unconsciousness, not interested in surroundings, lies curled up in the bed, photophobia. Symptoms: headache, irritability, depression. Cerebral compression results from either extradural or subdural hemorrhage. Patient is restlessness, unconsciousness, pulse slow and bounding, respiration slow and deep, pupil lesion side dilated, reaction to the light is poor. Later stages, pupil become widely dilated and fixed, no reaction to the light. Investigation: blood test, lumbar puncture, X-ray picture, CT, MRI scan, EEG, carotid angiography, echoencephalography. Management: emergency care, we have to making sure that the patient has enough oxygen and an adequate blood supply, maintaining the blood pressure, and preventing any further injury to the head or neck and other parts of the body. Rails tube feeding, O2 SOS, IV fluids, IV antibiotic, analgesic, antacids, monitoring of temperature, pulse, and respiratory rate, BP, and cardiac monitoring. Observe the Glasgow Coma scale. Next, complication. Post-traumatic headache and epilepsy, infection like meningitis, loss or a change in the sensation, hearing, vision, taste, or smell, paralysis, metabolic disorders, speech and language problem. Conclusion: head injury patient needs not die at the site of accident. Head injury patient should be carefully assessed in order to categorize them. The more severely injury should be stabilized and referred as soon as possible. Multidisciplinary approach is key in the management of head injury patient. Improve the medical facilities coupled with the skill, first contact a physician and appropriate public awareness will improve the prognosis. Thank you.
Thank you, Dr. Jain.
Thank you, sir.
I would like to invite Dr. Sreedevi for the poster presentation.
Good evening, everyone. Myself, Dr. Sreedevi, final year PG scholar RSB from BMK Ayurveda Mahavidyalaya, Belgaum. My title of the poster is The Anti-Inflammatory Action of Sallaki Resin Boswellia serrata in the Sandhivata. Objective: Sallaki Boswellia serrata exudate is also known as kunduru. It is consumed in different formulations to counter various illnesses. Out of this, the influence of the Sallaki in the management of osteoarthritis has made it gain wide popularity among clinicians due to its anti-inflammatory actions. So this poster emphasizes presenting all the therapeutic effects of Sallaki with regards to its influence in anti-inflammatory action. So I have taken the materials from the literary sources from Bhavaprakash Nikandu Adarsh, Uttarartha, Dravyaguna Vignan. And I have also used the network pharmacology. In that, many databases are also used. In that, first one is the Dr. Duke's phytochemical and ethnobotanical databases, which gives a list of chemicals and activities for a specific drug using its scientific or common name. It can also find out which drug have the highest level of a specific chemical. The second one is PubChem. It gives millions of compound structure and contain multiple substances description. And the Swiss ADM is also MolSoft. And the fourth one is Swiss target prediction, that is Swiss ADME, that is absorption, distribution, metabolism, and excretion. It shows the GI absorption, blood-brain barrier permeation, and bioavailability. Bioavailability comes under the subcategory of the absorption. It shows how much the fraction of the administered drug reaches the systemic circulation. When a medication is administered intravenously, its bioavailability is 100%. If a medication is administered by routes other than the intravenous, its bioavailability is generally lower than that of the intravenous due to its intestinal endothelium absorption. And some articles also, like which is published in PubMed, Scopus, and some research journals. And coming to results, its Rasa Panchaga, Rasa is Tikta, Madhura Kashaya, and Guna is Snigdha Guru Tikshna, Virya is Ushna, Vipaka, Madhura, and Prabhava is Shodhahara and Vedana Stavana. As Sallaki is directly indicated as Shodhahara and Vedana Stavana, it can be directly indicated in the osteoarthritis by reducing its anti-inflammatory and pain. So some article shows the anti-inflammatory action in experimental study. They have induced co-edema in animal albino rats. So it shows effective in edema and it shows significant reduction in spontaneous locomotor activity. And pharmacological activities of Boswellia serrata shows Sallaki capsule, which they have given the Sallaki capsule, which consists of 125 grams of boswellic acid, which is responsible for the anti-inflammation. So these are the pictures which I have shown, and this is the model which I have got through bioinformatics. So this is a 3D model where they have mentioned the targets and proteins through they have connected, and many pathways are also mentioned. And coming to discussion, as Vadadosha and Shodha and Shula will be decreased due to the Kappadosha increment, and it reduces the swelling and pain and easy movement of the, it helps for the reduction of the swelling as well as pain and easy movement of the joints. And in some articles, we can see like non-phenolic fraction of the Boswellia serrata shows extraordinary anti-inflammatory and analgesic effect. And this Sallaki contains volatile oil 4 to 8%, acid resin 56 to 65%, and gum 20 to 36%, 3-acetyl and 11 keto boswellic acids also. And it preserves the structural integrity of the joint cartilage, and it suits the joint, treat the level of the synovial fluid, lubricate the joint, improve the blood supply through vascular phenomenon, and it is easy to rotate and move and restore integrity of the vessels. These I have collected from the different research articles. And the binding through network pharmacology, I got binding affinity with the ligands. Like binding affinity is the energy which will be dissipated during the molecular bonding, and it shows lesser the affinity, more chances to get the receptor and target to get bind. In coming to conclusion, boswellic acid are the bioactive phytoconstituents which have demonstrated promising results in numerous experiments and clinical studies. Its medicinal properties are widely recognized for the treatment of ailments ranging from inflammatory conditions. This poster demonstrates the importance of the considering Rasapanchaka phytoconstituents while choosing the drugs suitable for the treatment of any disease. The influence of Madhura Rasa and Shodhahara property in Sallaki used for the managing Sandhivata plays a key role in the successful nullification of the Kappadosha, which is predominant in Prithvi and Jalamahabhudas. Similarly, same logic can be incorporated in managing all the diseases that is hampering the Samavasta of the doshas and Dhadus in the body. Thank you.
Thank you, Dr. Sreedevi.
Next, I invite Dr. Vishal Dattatray for the paper presentation.
So my topic name is paper presentation on effect of Ayurvedic treatment in avian, avascular necrosis of head of femur. Let me introduce myself. Dr. Vishal Dattatray, Sanap, MD Kai Chikitsa from SV Nisha Ayurvedic College, Rahuri. And my guide name is Dr. Jyoti. My title is a single case study on role of Ayurvedic management on avascular necrosis of head of femur. Abstract. Avascular necrosis is death of bone tissue due to interruption of the blood supply. Then second one, without treatment, the process is almost always progressive and joint pain may develop, which may limit the ability to move. Third one is complications may include collapse of the bone and nearby joint surface. Treatments may include medication, not walking on the affected leg, stretching or surgery. Next one, a diagnosed case of avian male patient come with the complaint of severe pain in both hip joints and both thighs, difficulty in prolonged standing, walking, sitting, restricted movements of both hip joints, and disturbed sleep due to pain. It was correlated with Vata Vyadhi and treated accordingly. A little effort has been made in this study to evaluate the effect of Tiktakshirabasti in the management of avian of the femoral head. Patient had been administered Dipana Pachana and Vata Shamaka Aushadhi along with Tiktakshirabasti. There are 3 cycles of 15 days with interval of 15 days. There was moderate improvement found in all signs and symptoms. This case study suggests that Tiktakshir Basti Karma provide a significant result in Vatvedhi, and so it can be a better option instead of surgery in avian. Then introduction. Avascular necrosis of femoral head is a pathological process that results from interruption of blood supply to the bone. It is also called as osteonecrosis. AVN is caused due to the injury or any other occlusion in the blood vessels nourishing the bone tissue. Going further, the process is always progressive and leading to joint destruction. It is a disease of mild age that most often occurs in fourth or fifth decade of life. AVN is the condition affecting different bones as a result of transient permanent loss of blood supply to the bones. Initially, patients are asymptomatic, but in time, AVN leads to joint destruction requiring surgical treatment, and in later stages, total hip replacement. Ayurveda has been playing a major role in treating chronic or untreatable conditions of AVN. So an effort was made to evaluate the efficacy of Ayurvedic formulations in the conservative managements of AVN. On the basis of this, concept, a case of AVN was managed, and outcome of the treatment is as follows. Then case report. A male patient aged 55 years diagnosed with AVN on the basis of magnetic resonance (MRI) was admitted in the IPD of Kai Chikitsa department, SV Nishti Ayurved College, Rahuri. By occupation, patient was a farmer. He was suffering from severe pain in both hip joints and both thighs, difficulty in prolonged standing, sitting, restricted movement of both hip joints, and disturbed sleep due to pain since 2 years, and was recommended for surgical intervention. But the patient was not willing for operation, and in search of better option, he approached Ayurvedic treatment. History taking revealed that all the symptoms developed gradually for last 2 years. He was suffering from constipation often. His appetite was good. Sleep pattern was disturbed due to pain. No significant family history was present. There is no history of injury also. Then treatment. Ashwagandha plus Guduchi plus Gokshur and Amlak in a churna form, each of 2 gram, 2 times a day. Then second, Laghu Yograj Gugul, 2 tablets 3 times in a day. Third one is Shunthi plus Haritaki Churna, 3 grams each 2 times after meal. Then fourth one is Stanik Snehan Swedan of Ubhaypad, Kati, Udar Pradesh with Nirgundi Tail and Bashpaswed. Tiktakshir Basti, इसमें मधु 80 ml प्लस सैंधव 10 ग्राम प्लस गोघृत 80 ml, देन क्षीरपाक 200 ml. इसमें चूर्ण कौन कौन से आते हैं? तो काड़े चिराइत, गुड़ुची, शतावरी, अश्वगंधा, यष्टि मधु, पद्मज, आमलकी एंड मुस्ता. देन मैंने कुछ उनके मतलब पेन और उस हिसाब से कुछ पॉइंट्स निकाले थे, उनको पॉइंट दिए थे स्केल के हिसाब से कि उनको कितना तकलीफ था फर्स्ट साइकिल में, सेकंड साइकिल में, देन थर्ड साइकिल में उनको कितना रिलीफ मिला. तो एक्चुअली मैंने वो पेशेंट देखा तो उसमें ज्यादातर इंप्रूवमेंट एलोपैथ से ज्यादा मुझे आयुर्वेद में दिखाई दी. उस हिसाब से उसका जो पहला साइन था वो था वाम वंशन संधिशूल. तो हर एक को मैंने 10-10-10 इस हिसाब से पॉइंट दिए थे. वाम वंशन संधिशूल फर्स्ट साइकिल के बाद उसमें 9 पॉइंट्स दिए, सेकंड में 7 और थर्ड के बाद उसमें 5 पॉइंट्स दिए गए. देन सेकंड वाला था दक्षिण वंशन संधिशूल. इसमें भी फर्स्ट साइकिल में 8, सेकंड साइकिल में 6 और थर्ड साइकिल में मुझे 4. देन थर्ड साइकिल जो था थर्ड वाला जो था कि सकष्ट उत्थापन एंड उत्कटासन मींस उसको भी वो टाइम में फर्स्ट साइकिल के बाद 8, सेकंड के बाद उसको रिलीफ मिला 5 एंड थर्ड में भी 5. देन सकष्ट चक्रमण चलते वक्त उसे बहुत ज्यादा तकलीफ होती थी, उस हिसाब से भी मैंने उसको फर्स्ट साइकिल के बाद उसे 8 पॉइंट्स मिले, सेकंड में 5 और थर्ड साइकिल के बाद 5. मतलब इंप्रूवमेंट डे बाय डे जैसे जैसे उसकी तिक्तक्षीर बस्ती मैंने चालू रखी उस हिसाब से उसको इंप्रूवमेंट मिलता गया. Then discussion. Considering the history and examination of the patient, treatment was planned. Presentation of the patient with pain in bilateral hip joint showed the involvement of Vata dosha associated with Asthibha Shrotas. Hence, the Basti Karma planned in schedule of Tiktakshir Basti with interval administration of Laghu Yograj Gugul, Ashwagandha Churna, Guduchi Churna, Gokshur Churna, Amlaki Churna and Shunthi and Haritaki Churna. AVN is caused due to the injury or any other occlusion in the blood vessels nourishing the bone tissue. In avian, major role of Rakta Dhatu is Jivana, that is giving life. It is the vehicle for prana which carries it through the body. According to Ayurvedic point of view, there is no direct correlation with avascular necrosis, but on their clinical presentation, there is Vat dominancy and Vikruti of Asti Dhatu. In advanced stage, due to continuous vata dosha, due to necrosis imbalance, it further responsible for violation of pitta and kapha. So in this study, Basti is a choice of treatment for avian because Basti is first line of treatment of vata dosha as well as pitta, kapha dosha and rakta also. Tiktakshir Basti is very effective treatment for avian. The decoction made in Kshir Paka, which having madhura and snigdha properties, which help to control vata dosha and due to sukshma guna of Saindav, it reaches up to micro channel of the body and help to open fresh blood supply to the bone tissue. In this Basti, Tikta Dravyas are having Tiktaras, Ushnavirya, Madhur, and Katu Vipak. Favors normal functioning of Dhatvagni, means metabolic state, facilitating increased nutrition to the Asidhatu. In this study, observed that along with certain palliative medicine is effective in the management of avascular necrosis of neck of femur. Then references, there are few references, Kashinath Shastri, then Gorakshanath Chaturvedi, then there are 4 or 5 references are there. Okay, thank you so much.
Let's invite Dr. Ankit Bhoir for the paper presentation.
Yeah, myself, Dr. Ankit Bhoir, PG final year student, chikitsa department from Ayurvedic Seva Sangha College, Nashik, Maharashtra. My topic for presentation is effect of Langhan chikitsa in Aamvata, guided by Vaidya Eknath Kulkarni sir, Vaidya Sanjini Rathod. In this topic, we are talking about Langhan chikitsa. So the meaning of Langhan chikitsa, we are talking about the authentic Ayurveda treatment, that is Anshan-rupi Langhan, means complete fasting without giving any food. So introduction, rheumatoid arthritis, that is musculoskeletal chronic and autoimmune joint disorder affecting a large population. It is symmetrical, restrictive, and deforming disorder. Prevalence of RA is 0.8 to 1% in Europe, and the Indian subcontinent with female to male ratio 3:1. That is, in female the ratio is higher. Highest prevalence in the world is in Paima India, that is 5%. Aamvata is there from the two words Aam and Vata, where Aamvata is the condition where Sabdata of the body parts occur due to Aam, that is various elements in the body which creates toxic effects in the body, combined with Vata dosha causes vitiations of the Vata dosha and occupies various sthanas, that is musculoskeletal joints, and manifests the disease Aamvata. In modern era, due to sedentary lifestyle, that is Nishalatva, low digestion fire, that is Mandagni, exercise after having oily foods, Snigdha Ahara Pashchatvayam. These are the specific Nidan which are explained by the Madhavkara in 16th century AD. The first line of treatment of Aamvata is Langhan, followed by Pachan, Virechan, and Basti, supported by the Ruksha Swedha. Methodology, patient name XYZ, age 60, Desh is Anuk to Sadharan. So patient was South Indian, shifted in Maharashtra, Nashik region. Male patient, Kal was Visarga, Rutu was Varsha Rutu to Sharad Rutu. So disease started in Varsha Rutu, which progresses towards the Sharad Rutu. Patient had history of liver cirrhosis 10 years back, malaria, typhoid, and MI 2 episodes. Surgical history, hemorrhoidectomy and appendectomy 25 years back. Drug history, patient has taken Ayurvedic treatment for liver illness and naturopathic treatment for arthritis. Addiction history was none. Patient was complaining of on admission pain and swelling in the bilateral MTV joints and metacarpophalangeal joints, bilateral wrist, ankle, knee, and elbow joint pain. Morning stiffness and restriction movement were there. Body ache, mild fever, loss of appetite was there. Samanya Parikshan, vitally patient was stable. Mala was asamyak, that is Samta was present, and in Nidra, continued Nidra due to pain. Shuddha was Mandya, random sugar was 1 or 2. In Sandhi Parikshan, in Astanguli, we have differentiated the joints in 5 different factors, that is Shul, Shodh, Sparsha, Grahata, Sparsha, Asatva, and other. In other, deformity can be there. So in Astanguli, Shul was 2 plus, Shodh 3 plus, Sparsha was Anushna, Grahata 3 plus, Sparsha Asatva 2 plus. So in Padangulu, 2 plus, Shodh was 3 plus, Grahata was 3 plus, Sparsha 2 plus. So similarly in other joints also, there was 2+ and 3+ complaints were there. Investigation eye test was positive, serum cream was 0.7, urine was normal. So we have diagnosed the patient on the basis of Ayurvedic diagnostic technique, that is signs and symptoms of the Ayurvedic criteria. In addition, eye test was positive, so it was supporting our diagnosis. These pictures are intermediate treatment results. So we have started the Langhan chikitsa after 7 days of total Langhan. These photos had been taken. So you can see swelling in the feet, swelling in the right hand, swelling in the knee joints. So these photos were intermediate treatment results. सामान्य चिकित्सा of Aamvata is Langhan, then followed by Tikta Deepana and Kadudravya, followed by Virechan, Snepan and Basti. So this was the result in patient after treatment. So you can see the wrinkles formation in the joints. So swelling has totally reduced, stiffness was reduced, range of movement were free, and pain was relieved. Treatment follow-up, we have given Langhan chikitsa, that is complete fasting with Shunti Siddha Jal according to Thas. So Shunti Siddha Jal, why we have given that is the Tikta Katudravya advice in the Chikitsa Sutra. According to Thas, so if patient feels thirsty, then he can take sips of Shunti Siddha Jal. Otherwise, no water, no food, no solid food, nothing. Then we shrunk complete bed rest. We were monitoring the vitals, BP, ECG was done, pulse rate and other vitals we were checking. Mauna Dharan, that the patient can't talk anymore. Guru Pravran, that is taking warm clothes, vital monitoring, intake output monitoring. Treatment followed. So after 7 days of complete fasting, we have shifted the patient to Lagvashan. So once the Agni has improved and the Samyak Langhan symptoms had been seen, we have shifted patient to Lagvashan. That is, we have started Laghu Ahar, Mudgiyush, morning and evening, and with Panchakol Churna till appetite improves. Diet modification in Pachan Chikitsa with Lagvashan, we have started Ampachakvat, Hingvastak Churna, 500 mg BD with Prathama Kaval grass with Grotha, Shunti Siddha Jal, 100 ml whole day. In bio treatment, Shotar Lep, local application we have given. Eranda Snepan 30 ml with milk in the morning for 3 days. So once the Langhan has been stopped, we started Lagvashan, we started bio chikitsa, we started Eranda Snepan 30 ml in the morning for Mrudu Virechan. In Shodhan chikitsa, after 3 days of Lagvashan, Shodhan chikitsa has been advised. So Virechan procedure we have done. For that, Grutapan for 4 days had been given. Patient was having all the Ama symptoms, so Triphala Grutha has been advised. Virechan Kalpa Trivrut Avliya, 25 grams of Sabhayadi Modak, 250 mg was given. Shotara Lef in Biochikitsa we have used. The contents includes Shunti, Ambelat, Rakta, Rohita, Haridra and Senda was there. So what is Langhan Chikitsa? Yet Kinchit Lagav Garam Tat Langhan Srutam. Tarak has described this slok. Langhan Lagava Yet Tad Evase Apatarpan, which was Apatarpan. So in Aamvat disease, Prithvi of Mabut dominance is there. So in Langhan Chikitsa, Tej Ayu Akas Mabut is present. So Langhan Gunas Laghu Vishnu Tikshna Vishidam, Ruksha Sushma Karam Saram, Katinam Yadravya, Prayas Langhanam Sutam. Types of Langhan, Sharaka, that was Dravirup and Adravirup. In Dravirup, Vaman, Virechan, Shiravirachan, Nero. In Adravirup, Pipasa, Marut, Atap, Pachan, Upas and Vayam. Pagbat has given Shodhan and Shaman as the types of Langhan. How does Langhan works? So Anavasthit Doshana, Pachanamane, Dipanam Durase, Nashanam Ahar, Ichagara, Ruchikaram, Lagar. Sushrut in Uttastan has given this law. So digestion of food takes by Dattatray. If not food, then it digests Vikrut dosha. So food has not been given, then it digests automatically Vikrut dosha, and if duration is, then it digests normal dhatu also. So Langhan Atiyog, in Langhan Atiyog, it can digest normal dhatu also. But in our Chikitsa, we are giving Samyak, we are giving Langhan till Samyak Langhan Chikitsa only. Langhan Chikitsa, the classical and first line of treatment of Aamvat is Langhan in the form of Upwas fasting, which is Agni, Vayu and Akash Mahabhut dominant treatment along with the Shunti Siddha Jal for the Pachan of doshas and Ruksha potentiation for the Shavana of local doshas and pain management. The action of Langhan takes place as it digests and vishes doshas in the body by Agni. The Langhan acts exactly as autophagy process. So we are focusing modern approach, that is autophagy process. Autophagy or cellular self-digestion is a cellular pathway involved in a protein and organelle degradation by lysosomes. In rheumatoid arthritis, anti-CCP antibodies are formed. Autophagy seems to be involved in the generation of the citrullinated peptides. Autophagy, that is autophagocytosis. It is cell-digesting mechanism responsible for the removal of the damaged organelle, malformed proteins, and long-lived proteins by lysosomes. By influencing lymphocyte development, survival, and proliferation, autophagy regulates the immune response against self and non-self antigens. Deregulation of autophagic pathway has been implicated in several autoimmune diseases. Example in RA and in cancer also. Autophagy seems to be involved in the generation of citrullinated peptides. Autophagy reduces with age protein involved in the autophagy. So, if, as the age increases, autophagy process reduces. Regulators of autophagy controls regulators of inflammation and autophagy is activated in response to diverse stress and physiological condition, that is food deprivation. Mechanism, that is formation of the double membrane vesicle around the proteins, which encapsulates the cytoplasm and malformed proteins, fuses with lysosomes and degradation starts. Role of so these are the research, previous research in the international journals. We have taken the references of that, which has been already research has been done. Role of autophagy in rheumatoid arthritis. Frontiers in Immunology, July 2018, Volume 9, Article 1577. In rheumatoid arthritis, autophagy activation was found to be essential for the survival of inflammatory cells. Example, cyanoitis and lymphocytes. Important roles in citrullation and osteoclastogenesis. Repression of autophagy could expose patients to premature aging, infections, and development of malignancy. Next article, that is anti-rheumatic effect on fasting. So this article has been published in Rheumatic Disease Clinics of North America, 1st May 1991. So which says that total fasting induces within few days shows substantial reduce in the joint pain, swelling, morning stiffness, and other rheumatic symptom remissions, diminish activation of neutrophils and lymphocytes, and decrease generation of leukotrienes and other pro-inflammatory factors. Thank you.
Next, I invite Dr.
Thank you,
Ashwani
sir.
Lohia for the paper presentation.
Okay, so I'm Dr. Ashwani Lohia from Sri Dharmsala Madheshwara College of Ayurveda, Udupi. And today I'm presenting my paper on significance of extra pharmacopoeial drugs. Coming to the introduction. So as we all know, the knowledge of Ayurvedic literature, but documented in the classical text of Ayurveda. So these dravyas are called as to the chronology. In Veda Kala, in Rig Veda, we had 67 plants. In Yajurveda, 81 plants. In Atharva Veda, number increases to 189. Then coming to Samhita Kal, Charak Samhita, 1100 plants. Sushrut Samhita, 1270 plants. And Ashtang Hridaya, 11504 approximately. Then again moving to Nighantu Kala, addition of around 400 new medicinal plants have been seen. So I have taken few examples of Anukta Dravyas and I've just randomly picked them. So first one is Arogya Pacha. So what is the meaning of Arogya Pacha is greener of health. That is the one that gives good health and vitality. So its botanical name is Trichopa zelanicus and it belongs to the family Dioscoriaceae. According to the Kani tribe of Agastya Hills of Kerala, the unripe fruits of Arogya Pacha are used for instant stamina, health, and vitality. So by looking at some of the morphological characters and properties described, it can be compared to that of Varahi mentioned by Acharya Sushruta. Coming to the next drug. Sorry, before that, I have put the pictures of literature. And then coming to the next drug, Achoka or Noni, which the name is Morinda citrifolia. It belongs to the family Rubiaceae. So traditionally, it is used as a therapeutic remedy to various diseases as an antibacterial, anti-tumor, anti-helminthic, analgesic, anti-inflammatory, immunostimulant. It has also proved beneficial in conditions like gastritis, skin diseases, respiratory infections, menstrual and urinary tract disorders, fever, diabetes, and venereal diseases. So, as we all know, that noni juice is very famous and very commonly available in many of the shops, and it mainly an antioxidant and it has anti-cancerous property also. So this is the fruit of noni, which is also called as cheese fruit in English. Then the next one is Kadu Garud Patala. That is the Kannada name for the drug Chesselia curviflora belonging to the family Rubiaceae. So this Kadu Garud Patala is also the Kannada name for Sarpagandha. And the significance over here is that this drug Chesselia curviflora is used as a source of Sarpagandha by Kani tribal folklore in Arukani Hills, Kerala. And the root and leaf of this drug is used to treat jaundice and wounds. Juice of leaves boiled with oil is used for ear and eye diseases, ulcers, and sore throat. Decoction of root is given as a remedy in phlegm, rheumatism, and pneumonia. So these are the fruits of Chesselia curviflora, and these are the leaves. So the next one is Ritubana Shvetamula. It is commonly called as mimosa thorn. Botanically, it is Sizzlepenia mimosoides, belonging to the family Sizzlepiniaceae. So, in some parts of Karnataka, the stems and branches are boiled with sesame oil and are administered in two split dosages to alleviate discomfort in the joints, that is, Vata disorders. And in Kerala, fleshy roots of this plant, along with ginger paste, is used as an anti-helminthic remedy. So, researches have been conducted already on this drug, and it is proven to have such effects. So, this is the fruit of Rituban, and these are the leaves. And in the background, I have displayed the picture. So, coming to the discussion and conclusion part. It is mentioned in the classic text that there is no plant which is devoid of medicinal property and should be used efficiently through one's knowledge. These drugs are used in Ayurveda on the basis of their pharmacological properties such as rasa, guna, virya, vipaka, and prabhava. So many plants of the original sources, as we all know, are being overused due to which they are either extinct or on the verge of extinction. So there is a need to explore the local flora. Hereby concluding, the study and evaluation of such extra pharmacopoeial drugs, which are also used by folklore practitioners, will enhance our knowledge and give us a broad perspective in treatment aspect too. It will be a boon to materia medica of Ayurveda when the Anukta Dravyas will be documented after having sufficient knowledge about their pharmacological properties. Thank you.
Okay, next I invite Dr. Naveen for the poster presentation.
Myself, Dr. Naveen Santosh Gaddam. I am from College of CRC Nigri Pune. I am presenting a poster presentation on Samprapti of Aamvata. I have collected this information from various granthas like Charaka and Madhavnidan, etc. Okay. I have divided these hetus and sampraptis according to the Shadakriya Kalas. Now, samprapti of Ama starts from the intake of Ahariya, Vihariya, and Mansik hetus. Ahariya hetus are Viruddha Ahar, Snigdha Ahar, Guru Ahar, etc. I have summarized some in this. Okay. Vihara hetus are Divaswapna, Nishchalta, Krodha. Mansik hetus are Chinta, Shoka, Bhaya. These all hetu intake causes Agni Mandya, and according to Ayurveda, Roga Sarvayakti Mandagna, it means every disease arises from the Mandagni. When the function of Agni is vitiated in the body, there is poor digestion and there is causes of Aamvisha. So when there is Agni Mandya, there is a formation of Aamvisha. This Aamvisha combines with the Prakrut Vayu and makes it Sam Vayu. This Sam Vayu travels in the body with the help of Damanyas and gets lodged in these Leshma Sthanas. and that is dushited by the three doshas. And when it is when there is three dosh dushti, there is Sanshram in the Rasava Shotas and Trikasandhi. When there is Sanshram in Rasava Shotas, there is Dorbalya Sandhi Shota and Shuddha. When there is dislodgement of Amavisha uh, in the Trikasandhi, there is Sandhi Stabdata. This causes Aamvata. Thank you.
Thank you, Dr. Naveen. Next, I invite Dr. Priyanka S. Yadav for the poster presentation. Dr. Priyanka, please unmute, Doctor. Dr. Priyanka Yadav.
Yes, sir.
Okay, Doctor. Please share the screen, Doctor.
Yes, sir. Oh. So can you please share my PDF?
Okay, Doctor. Just a second. Dr. Priyanka, please start the session, Doctor.
Yes. Okay. Myself, Dr. Priyanka from Late Kadari Redikar College, Kolhapur. My guide is Dr. Sawant sir, Shailendra Sawant. My topic is suture material and surgical needle. Suture material, a suture is any thread or strand which bring into a position two surface or tissues. Types of suture materials and some features of suture materials. I have noted over here: absorbable materials, non-absorbable materials. Absorbable materials are it is absorbed in the body. It is either digested by the enzymes and removed by the phagocytosis, or broken by the hydrolysis and then removed by the phagocytosis. Non-absorbables are the type of suture which remains in the body and retains its tensile strength for about at least 1 year. Examples are over here: classification. Plain absorbable contains plain catgut, chromic catgut, vicryls, dexon, monocryl. Non-absorbables are silk, polypropylene, cotton, linen, nylon, etc. Second property is tensile strength of material. Straight pull tensile strength, not pull tensile strength. In this, not pull tensile strength is more important than straight pull tensile strength. Smoothness. Smoothness decide whether the knot will be secured or not. Not securities. Now the filament arrangement of the threads: monofilament, polyfilament, and twisted. Twisted polyfilament is further divided into twisted, braided, and flossed. Here are some classifications. Now we move to the surgical needles. The surgical needles are sharp pointed instruments. They are used for puncturing the tissue, for guiding the threads or wire to suture or pass a ligature around the vessels. The types of surgical needles are according to eye: eyeless needles, needleless with eye, needles with eye. Here are the structures of the needle, shape of the needles. According to shape: straight needle, curved needle, single arm, double arm. Curved needle includes two, single armed and double arm. According to cutting edges: round body needles, cutting body needles. Cutting body needles is further contains of conventional cutting needles and reverse cutting needles. According to its tip, it has triangular tip needles, round, blunt, point needles. Here are the shape, size of the needles, their tip, and what are the things mentioned on the suture materials are over here. Thank you, sir.
Thank you, Dr. Priyanka.
Hello. No. Thank you, sir.
Next, I invite Dr. Jyoti Power for the paper presentation on the topic nutrition in pregnancy. Dr.
Yes.
Jyoti, are you there?
Yes, sir. Yes, sir. I'm
Okay, doctor. Please share the screen, doctor.
just a minute, sir. Is it visible, sir?
Yes, doctor. Visible, doctor. Please start the session.
Good evening, everyone. I'm Dr. Jyoti Pawar from SVNST Ayurved Mahavidyalaya, Rahuri, Ahmednagar. Here I am starting my presentation on nutrition in pregnancy. Introduction. Women have special we
Hello, Dr. Jyoti. Hello, Dr. Jyoti Power. Can you hear me? I think it was some network problem. Next, I invite Dr. Nisha Jain. Dr. Nisha, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor.
So screen is visible, sir.
Yes, doctor. Visible, doctor. Please start the session.
Start it, sir. So screen
Sure,
is
doctor.
visible.
Screen is visible. Screen is visible, doctor. Please start the session, doctor.
Good evening. Myself, Dr. Nisha, second year PG scholar from the Department of Shalya Tantra. My topic is on Granthi under the guidance of the Dr. Sukesh, sir. Introduction. Granthi is a swelling which may be a hard or soft. The word meaning of Granthi is a lump or knot. Granthi is defined as Uttonatam vigratitam tu shofam kurvantayato vigratitam Granthi riti pradustam. According to Sushruta, which meaning of swelling which is spherical in shape, rise from the skin surface and resembles slight knot. Similarly, a cyst is a fluid-filled sac which can occur in any part of the body, can varies in a size. Granthi is a kapha pradhana tridosha vyadhi. Granthi can correlate it to cyst. In Greek, the word meaning of the cyst is bladder. Cyst is a collection of fluid in a sac which is lined by the epithelium or endothelium. Cyst is mainly of two types. True cyst, which is lined by epithelium or endothelium, false cyst, which don't have a lining of epithelium or endothelium. Now coming to the definition and samprapti. Vata daya mamsa astrukcha pradusam sandushyat medascha kafanuviddham ruttonatam vigratitam tu shopam kurvantayato vigratitam tu pradustam. When the dearranged vata vitiates the mamsa, shonita and meda mix up with the kapha and they produces the circular raised and knotted inflammation swelling called granthi. Dosha involved in Granthi are Kapha Pradhana Tridosha. Dushyas are Meda, Mamsa, and Rakta. Coming to the classification, according to Sushruta, there are 5 types. Vataja, Pittaja, Kaphaja, Medaja, and Shiraja. According to the Charaka, there are 6 types. Only Mamsaja is added to Sushruta. Now coming to the Vagbhatta, Vataja, Pittaja, Kaphaja, Medaja, and Shiraja. Same as told as Sushruta and Charaka. Raktaja, Astija, and Bruna Granthi is added. Vataja Granthi, Ayam Yate Vethayata Eti Todam Pratyasyata Krutyat Eti Bhedam, Krishna Amruddu Basti Riva Vatasha Bhinnam, Swacha Nilaja Asram Acham. Lakshanas like feeling of stretching and vibrating, pricking pain, cutting and tearing pain. Cysts are black in color, hard to touch, feeling like a bladder distended with air. When it bursts open, serous enginous fluid will be there. Now, coming to the treatment, Hamsra, Rohini, Gandha, Gojiva, grounded with the Talapatra should be applied as a paste over the Granthi. Svedana, especially Upana Svedana. Pakwaja Granthi, it should be incised, drain the pus and washed with the drugs of Bilva and Arka. Then for Ropana, oil is applied. Pittaja Granthi, Dhandu ya Dhumyata, Choshyacha, Papachat, Prajwalativacha api. Raktasapitam, Apyattava api, Pittadi Bhinnam, Sveda Ushnam, Ativacha Asram. Sensation of severe burning, fuming, sucking, thrombing pain will be there as it is burnt to the ash. And red or yellow in color cyst will be seen. When it bursts, discharge are hot and excessive amount of blood will be there. Treatment, Jalauka Charna will be done. Cold Kwata of Kakolyadi Gana with grape juice or sugarcane juice. Virechana by Draksha and Ikshu and with Haritaki. Pakwaja Granthi is incised, washed with the Kwata of Vanaspati Dravyas. Vrinashodhana by sesame seed with Maduka. Vrinaropana by Gruta with Madura Dravyas. Kafaja Granthi. Shita Avivarna Alparuja Ati Kandu Pasha Navat Samhanana Upannanam. Sirabi Ruddischa Kafa Prakopadi Binnam. Swacha Shukla Ghana Chapuyam. Cold swelling without any discoloration. Mild pain, excessive itching, heavy consistency of stone increase slowly. When burst, white and thick pus will be discharged. Shodhana is done. Vimlapana by finger, iron rod, stones or bamboo sticks. Surgical excision of Granthi, then Agni Karma is done. Now coming to the Medaja Granthi. Sharira Vruddhi, Kshaya Vruddhi Hani, Snigdha Maha Alparuja Ati Kandu, Meda Kruta Gachati cha atra bhinnam pinyaka sarpi pratimam tu medam. Lakshanas. In Medaja Granthi, smooth, in touch, smooth, big in size, mild pain, excessive itching. When it bursts, fat which is similar to the oil or ghee, discharge will be there. Treatment, Kalka of sesame seed, Svedana, Bedana and excision by Agni Karma. Siraj Granthi, Vyayama Jata Balasya Teste Rakshapta Vayu hi Sira Patananam, Sampidya Sankochet Preshesham Cha Api Granthi Karatyu Anuttanam Ashu Vrattam, Granthi Siraja Satu Krutrat Bhaved Yadi, Syat Sarujascha Lascham. Arutsa Evam Apyam Chalo, Mahascha Marmastitaschapi Vivarjenium. In a person which are weak, indulge in more physical activities, Vata get aggravated and invades the networks of veins. Veins are squeezed, constricted and rise up. Give rise to the elevated and developing a round swelling of veins which is non-pulsatile. Is known as Siraja Granthi. Prognosis, Krutra Sadhya. If it is a penile, is movable, it is a Krutra Sadhya. Asadhya, which is painless, fixed, big in size, situated over the vital parts. Chikitsa, in initially recent origin, Sachari Taila for drinking. Upana with Vatara Dravya and Basti, Siraveda should be done. Sadhya Sadhyata of Granthi, Sadhya Vataja, Pittaja, Kafaja, Raktaja and Medaja. And Asadhya, big, hard, movable, located on Marma Pradesha and Kanta and Uddara Pradesha. Conclusion, it is important to prevent the occurrence of Granthi. Treatment in an early stage or allows proper maintenance of signs and symptoms, reduces the complication and support a better life. Various surgical conditions like cyst, lipoma, benign tumor, which are characterized by swelling, can be considered under the umbrella of Granthi. Based on Lakshana, Chikitsa, all cysts are considered, all cysts can be considered under the Granthi, but all Granthi can't be considered under the cyst. The treatment principle for both Granthi and cyst as swelling as homogeneous, which includes combination of conservative and surgical management. Surgeon should have a clear idea of the diagnosis and structure involving in order to prevent from the complication and reoccurrence. List of references, Sushruta and Charaka I referred, and that's for the modern. Thank you.
Thank you, doctor. Next, I invite Dr. Jyoti Power for the paper presentation. Dr.
Yes, sir.
Jyoti.
Yes. Yes, sir. Yes. I'm here. I will start with introduction.
Okay, doctor.
Ayurveda advices. Yes, sir. Yes, sir. Ayurveda advises congenital diet and regimen throughout the pregnancy. It also stresses on the healthy state of mind and body to beget healthy progeny. Milk and ghee stand out as the most common in pregnant diet that Ayurveda advises. The idea of this is to provide optimum amount of protein and fat to the body. In addition, it provides right amount of calcium and vitamins for the pregnant mother, helping in sustaining and comfortable lactation. In this review article, a design protocol of the month-wise diet advised by various ancient Ayurvedic physicians, which can be modified according to the age, seasons, place, constitution, and digestive fire of the pregnant woman has been presented. Protein requirement: 20% increased, 15 gram plus normal requirement. Food sources: good quality complete proteins are milk, egg, cheese, meat, or non-vegetarian food. Incomplete protein: pulses, legumes, soya products, etc. Minerals requirement: calcium, milk and products, pulses and legumes, eggs, greeny leafy vegetables, seafoods. Iron: liver, organ meat, poultry egg, yolk, whole grains. Iodine, iodized salt and seafoods. Zinc: seafoods, organ meat and poultry, wheat germs, yeast. Vitamins requirement: all the vitamins, that is A, B, C, D, E, K, to be taken in appropriate amount. B vitamin: food sources, meat, poultry, fish, organ meats, legumes, pulses, milk, green leafy vegetables. Folic acid: food sources are organ meats, dark green leafy vegetables, muscle meat, poultry, fish, egg, whole grain, cereals. Fiber requirements: 30 to 40% grams of fiber per day dietary. Sources: whole grain and cereals like wheat, jowar, bajra, ragi, whole pulses, legumes, fenugreek, vegetables, and fruits. Recommended weight gain: a weight gain of 11.2 to 15.9 kg is recommended as an average weight gain in pregnancy. If a woman is at high risk of nutritional deficit, a more precise estimation of adequate weight gain can be calculated. This is done by computing body mass index. Women who are high or low in weight for their height, BMI below 18.5 or above 25 kg per meter square need to have their expected outcome for weight gain adjusted. Women who are underweight coming into pregnancy should gain slightly more weight than the average woman, 0.5 kg per month or week. An obese woman might be advised to gain less than average 0.3 kg. However, to ensure adequate fetal nutrition, advise women not to lose weight during pregnancy. This is the pregnancy diet chart. Gestational diabetes diet. Diet: 30 kilocalorie per kg normal weight woman, 20 kilocalorie kg for overweight woman, and 12 kilocalorie per kg for morbidly obese woman. Diet should contain carbohydrate 50%, protein 20%, and fat 25 to 30%. Usually 3-meal regimen with breakfast 25% of the total intake, lunch 30%, and dinner 30%. Water foods are the main concentration, that means plants, vegetables, fruits, grains, and legumes, only low fat and non-fat dairy products. Avoid saturated fat, avoid fast foods, processed food, microwave foods, high sugar food, alcohol, and high sodium food. Drink plenty of fresh water every day. Eat 5 or 6 small meals every day. Eat your meal at the same times every day. Anemia in pregnancy. Anemia in pregnancy is present in every high percentage of the pregnant women in India. Exact data is not available about the prevalence of the nutritional anemia. However, according to WHO, the prevalence of anemia in pregnancy in Southeast Asia is around 56%. In India, incidence of anemia pregnancy has been noted as high as 40 to 80%. Iron requirement in pregnancy. Total iron requirement is 1000 milligram plus fetus and placenta 300 milligram in red cell mass 500 milligram. Basal loss 200 mg average requirement is 4 to 6 mg per day. This is the Garbhini Samanya Ahar according to Ayurveda. Masanumasic Garbhini Paricharya given by Acharya Charak and Acharya Shushruta. Garbhotkar Bhav given by Acharya Charak. Pradhan Mantri Surakshit Matritva Abhiyan. What is the program? The Pradhan Mantri Surakshit Matritva Abhiyan has been launched by the Ministry of Health and Family Welfare, Government of India. The program aims to provide assured, comprehensive and quality antenatal care free of cost universally to all pregnant women on the 9th of every month. Honorable Prime Minister highlighted the aim and purpose of the introduction of the Pradhan Mantri Surakshit Matritva Abhiyan in 31st July 2016 episode of Man Ki Baat. PMSMA guarantees a minimum package of antenatal care services to women in their second and third trimester of pregnancy at designated government health facilities. The program follows a systematic approach for engagement with the private sector, which includes motivating private practitioners to volunteer for the campaign, developing strategies for generating awareness and appealing to the private sector in participating in Abhiyan government health facilities. Goal of the PMSMA. Pradhan Mantri Surakshit Matritva Abhiyan envisages to improve the quality and coverage antenatal care, including diagnosis and counseling service as a part of reproductive, maternal, neonatal, child and adolescent health strategy. Objective of the program: ensure at least antenatal checkup for all pregnant women in their second and third trimester by a physician or specialist. Improve the quality of the care during antenatal visit. This includes ensuring provision of the following services: all applicable diagnostic services, screening for the applicable clinical condition, appropriate management of any existing clinical conditions such as anemia in pregnancy, induced hypertension, gestational diabetes, etc. Appropriate counseling services and proper documentation of services rendered, additional services opportunity to pregnant women who have missed antenatal visits. Thank you.
Thank you, Dr. Jyoti. Next, I invite Dr. Arjun V for the paper presentation. Hello, Dr. Arjun.
Good evening.
Good evening, Doctor. Please share the screen, Doctor.
Yes. Is it visible?
Yes, visible, Doctor. Please chat.
Good evening. Myself, Dr. Arjun. I'm here to present role of Agni Karma in Tok Rogas under the guidance of Dr. Santosh Kumar, Professor, Department of Shalyatantra from Karnataka Ayurveda Medical College, Bangalore. Agni Karma is said to be one of the best parasurgical procedures for, as it is said to be Roganam Apunarbhava, which means the diseases which are treated with Agni Karma never recurs. It destroys the diseases from the root. Agni Karma is said to be the best therapy for Vata Kapha-jani Vikaras, as Agni possesses Ushna, Sukshma, Tikshna, and Ashudari Guna, which are opposite to Vata Kapha doshas. It removes Srota Rota and increases the Rasarakta Samvana to the affected side. And these are the indications for Agni Karma. It can be done in Tvak, Mamsa, Sira, Snayu, and Asti in diseases like black moles, wart, cyst, and weakness of the body part, headache, Adimanta. Agni Karma is to be done on Tvak. Arshas, Bagandhara, Arputa, Ushtavrana to be treated with Mamsa Datta. And contraindications: Pitta Prakriti, Antashonida, Vinna Kosta, Anudrita Shalya, Durbala, Bala, Vriddha, Biru, and Anega Vrana Pidila. And Samek Dagda Lakshanas, Rakta Stambhana, Tvaksangoja, Shatta Pradurubhava, and Talafala Varna or Kapota Varna in Mamsa Datta, Talafala Varna in Tvak Datta, and wounds will be healing easily and there will not be of much pain. While practicing, it is very much important to create proper Samek Dagda so that the desirable results will be obtained. And Prushta Dagda Lakshana, Toka Vaivarnida and Daha, and Durtagda Lakshana will be the appearance of spota, severe pain and burning sensation. Aditagda Lakshanas, Mamsa Avalambana, Daha, Dhupana, Vedana, Siradinasha, Trid, Murcha, Gambira Vrana, and Mrityu. These are the measures to be adopted after Agnikarma. In Plushtadagda, Agnikarma is to be done again, or lepa of Ushna Virya Dravya can be used. And in Durtagda, Shita and Ushna treatment will be used. And in Samyakdagda, Tugakshiri, paste of Tugakshiri, Plaksha, Chandana, Gairika, etc. to be mixed with Gruda and then applied, and Pittaja Vitrati Chikitsa to be given. And in Aditagda, Pittaja Visarpa Chikitsa is to be given. Agnikarma as in a cosmetological approach. At one time, a mole on the cheek of a woman was considered fashionable, and some were even painted on. These were called beauty marks. Nowadays, the trends are changing, and people want to look perfect. As a result of this, people are willing to go to greater lengths to achieve this perfection. Cosmetology is nothing but a beauty treatment that will change the appearance of our external beauty. Some conditions which are aesthetically challenging, those which can be cured by Agnikarma are Charmakila, Tilakalaka, Mashaka, Katara, Granthi, Pranagrandhi, etc. And the benefits of Agnikarma are instant relief, less recurrence chance, Tad Dagdanam, Rokanam, Apunarbhavat, can be done in OPD basis and is cost effective. So, this is Agnikarma which is done on skin tags. Skin tags are just small growths on the skin that look a bit like the wart. They are connected to the skin by a small thin stalk. They are quite harmless and painless, and usually seen on fold of skin, usually armpits, groin, thighs, eyelids, and neck and under the breast. So this is Agnikarma which is done on skin tags. And another case of Agnikarma which is done on skin tags. So this is Agnikarma done using Panchaloka Shalaka in Katara. And Katara or corn is nothing but thickening and hyperkeratosis of layers of skin due to constant pressure and repeated minor trauma. So it can occur in soles, tips of toes, and dorsal surface of interphalangeal joints. This part has been excised and Agnikarma has been done using Panchaloka Shalaka. So this is the second sitting, and it's after the treatment. Now this is Agnikarma on viral wart of palm, and it's on plantar aspect. So warts are nothing but which are caused by human papilloma virus, just benign proliferations of skin and mucosa resulting from papilloma virus infection, and it's in slow growth. And there are several types of wart, as in common wart, filiform wart, flat warts, and plantar and genital warts. They are spread by direct and indirect contact. So this is Agnikarma in disseminated warts of the neck. So this is in common wart. So in Agnikarma, and a mole has been removed here. And another case. So Dr. Vanoff has said metabolism of local tissues improved where the heat burns. So it provides additional heat to the Dhattvagni and removes Srotavarata. Shastrakarma is for excision, while use of Agnikarma after excision is considered to be effective in avoiding the relapse in condition of benign outgrowth. Nowadays, modern instruments like uses cautery like instruments which are nothing but modified Agnikarma only. The instruments used were Panchaloka Shalaka, Suryakanta Shalaka, pen cautery, and electric cautery. Only in one sitting, warts, skin tags, moles can be removed successfully with no scar. So from these cases, it can be concluded that Agnikarma can be used for cosmetic purposes. So that's my presentation. Thank you.
Thank you, Dr. Arjun. Next, I invite Dr. Snehal Ramesh Kulkarni for the paper presentation. Dr. Snehal Ramesh Kulkarni, are you there? Hello, Dr. Snehal Kulkarni. Please unmute, doctor.
Yeah, sir, I'm there. Just 2 minutes. I'm sharing.
Okay, doctor. Your screen is visible, doctor. Please chat the
Okay.
session.
Good evening to all. Myself, Vaidya Snehal Ramesh Kulkarni. Sir, am I audible and my screen is visible?
You are audible and screen is visible, doctor.
Okay. Good evening to all. Myself, Vaidya Snehal Ramesh Kulkarni. My topic for the paper presentation today is a critical review of Shwasakuthar Ras and its uses in the respiratory disorder, guided by Vaidya Yogesh Bhatamre and HOD Professor Vaidya Kalyani Zadhav from Sumati Baisha Ayurved College, Hadapsar. What we are going to look for this is the classical references, the shlokas, the ingredients, and some detail of the Shwasakuthar Rasa. Basically, it's a Sagandha Niragani Kalviya Rasa Yog. References found are in the Rasendra Sar Sangrays and the various Granthas, but in short, the Shwasakuthar Ras first was in the Rasendra Sar Sangraha as Prathama, Dvitiya, and Tritiya. In Bhav Prakash, it has two references, that is in the Jvara Roga Adhikar and Shwasa Roga. In Bhaishaja Ratnavali, it's in Prathama and Dvitiya. But the Prathama is, the reference is according to the Dvitiya of Rasendra Sar Sangraha, and the Dvitiya part is as per the Tritiya of Rasendra Sar Sangraha. In the Yog Ratnakar and Yog Ratnakar, as well, the Rasakam Denu and Rasayog Sagar has followed Yog Ratnakar with a unique method mentioned as Ekam Maricham Datva. That is a procedure that one by one the maric could be added to the kalpas. In Bhaishaja Ratnavali, they have given the maricha quantity that varies from the 7 to 8 parts. I hope so you are all seeing my slides changing.
Slides are changing, doctor. Please continue.
Okay. Rasendra Sambhava has given two references as Dvitiya and Tritiya. The Dvitiya is as the two parts. The first is as per the Dvitiya of Rasendra Sar Sangraha, and the second is as per the Tritiya, named as an Bruhata Shwasakuthar. In Rasajala Nidhi, it's again with the two parts. The first is as same as the Dvitiya of Rasendra Sar Sangraha, and the third is as the Dvitiya of Bhaishaja Ratnavali. It's termed as an Mahashwasakutharas. In Rasa Chandanshu, it's Prathama and Tritiya of Rasendra Sar Sangraha. And Bruhata Rasaraja Sundara, it's as an Shwasari Ras, Prathama, Dvitiya, and Tritiya of an Rasendra Sar Sangraha. Also, the Bharat Bhaishaja Ratnakar has given the same references there. A quick review in the table as of the Shwasakuthar Ras. Shwasakuthar Ras has been explained by the Bhav Prakash, Yog Ratnakar, and same. The Prathama, Dvitiya, Tritiya are been just explained in the Rasendra Sar Sangraha and Bhaishaja Ratnavali and Rasendra Chandanshu. Mahashwasakuthar Ras is in the Rasajala Nidhi. Bruhat is been explained by Rasendra Sangraha. Shwasari Ras is given by the Bruhat Rasaraja Sundar and Bharat Bhaishaja Ratnakar. The reference is from the Rasendra Sar Sangraha as in Shwasakuthara Tankanam Paradam, Gandham Shilam Visham Katutrikam, Nishipanyam Vatika Karyam, Bana Gunja Pramanataha, Ushnodakam Pivenas Chanu, Shudra Kwatam Api Chavak, Kasam Panchavidam Hanti, Shwasam Shleshmam Samudbhavam, Shiro Rogam Nihantyakshu, Vruksham Indraksha Niryataha. The second Shwasakuthar reference is again the of the Prathama mentioned in the Rasendra Sar Sangraha, the Dvitiya mentioned in the Rasendra Sar Sangrahas. This shlok is a Rasogandha. The part here has been used as a maricha used in the Ashtabhagam Karshakam. It's given in the Bhav Prakash, Bhaishaja Ratnavali, then Vaidya Sangraha, Bruhat Nigantu Ratnakar, they have mentioned it. The second is mentioned in the Rasendra Chandanshu, Rasendra Sar Sangraha, Bhaishaja Ratnavali, Shwasari, that has been given in the given as Parado Vatsana Basham, Gandhakam Tankanam Kanaha, Samancham Dvagvinom Shunti, Maricham, Panchabhagikam, Sukshmas Churnam Idam Krutva, Valamatram Pradarpanit, Shwasari Saudnikom Yesham, Sadhya Shwasaharam Parahabula, Matlatala, Shwasakuthar Rasa, that is mentioned in the Yoga Ratnakar. It says Rasogandho Visham cha eva tankam cha manashilaha etani tanka matrani maricham cha ashtakam. Here they have used the marich as an 8 part, where the method they have given is that you should pour one by one marich and then the khal is been done. So eka ekam maricham datva khalve suksham vimardayet trikatum tankanam matram cha datva paschata vichurnayet Sarvam ekka matram sanyojam kachakuptam vinikshipet, that is to be kept in a kachkupi, that is in glass bottle. Again, that's a vidachapant, that is in the Latin, it is the betel leaf. Latin name, it's a piper betel that is used for the bhavana, and the tablets are made. Gunadharma of Shvasakuta are mentioned in the Yoga Ratnakaras and Kase Shvasescha Mandagno, Vatashleshma Ayushacha, Gunja Matram Pradattavyam, Parna Khandena Dhimata, Sannipate cha Murcha, Yapasmaram Tatha Punaha, Ati Mohotpanne Nasyam, Datva Vichakshanam, Rasaha Shvasakutarayo, Sarva Shvasa Vikaraha. It's Rasendra Sar Sangraha says Etani Samabhagani, Maricham Tat Chaturgunam, Iti Likhitam. So it's used in Tatha Cha Pratikshayam Chatakshinam Medakasha Vidam Kshayam Rudarogam Shvasashulam Cha Swarabhedam Sudarunam Tat Rudroga Anupanena Raso Nashayati Kshana. The ingredients used in this kalpas are Shuddha Parat, Shuddha Gandak, Shuddha Vatsanap, Shuddha Tankan and Shuddha Manashila. They are given in the equal parts. The difference occurs in the Maricha at it varies from 1 part to the 10th part, and Pimpli and Shunta it varies from the 1 part to the 6th part. In the tabular form, it's for the quick hit because as with the reference to the Granthas, the Rasendra Sar Sangraha as the Prathama, Dvitiya and Tritiya, it differs with the Marichas 1 part, 2nd part, 7th part. Pimpli and Shunta as in the 1st and Dvitiya part, it is 1 part. In the Tritiya part, it is 3. In the Bhav Prakash, Maricha is 10th part, Pimpli and Shunti is twice a part. Yog Ratnakar, it's a 9 part, and Pimpli Shunti is 1 part. Same as for the Bharat Vaishajya Rasendra Chandanshu, same has been given as you can see the screen. For the time being, I'm just quicking up with the tables. So drug details here as Kajali, it's a Shuddha Parad and Shuddha Gandhak. Powdered form, the karma are Yogavahi, Rasayan, Bruhani. Appearance it as an Anjana Sadrusha. Shuddha Vatsanap, Aconitum ferox. Part used is the roots. Karma are Yogavahi, Vyavai, Vikasi, Vedana Shamak. Appearance, we can say it's an Abhyantara. It's a whitish, whereas the outside part is a Krishnabha. Shuddha Tankana, borax, powdered form it's used. Karma is Vishagna and Kshariya. White color Bhasma form, Manashila, it's a regular red arsenic. Powdered form it's used. Rasayan and Yogavahi, it's an orangish red Bhasma form. Maricha, Piper nigrum, in English we commonly say as in black pepper. Fruits is used, Deepan Pachan Karma. Green, it's in Apakva stage. In Pakva stage, it's red in color, and the use form we use in the kalpas are in the black. Pimpli, it's a Piper longum. Part used is the fruit Karma, Vrusha Rasayan. Shunti is Zinzabar officinalis. Roots are used, Vrusha, Vajikarana Pachan. Properties as Kajali, it's in a Sparsha, it's a Mrudush Lakshana, Rupa, Anjana Sadrusha, Gandhaka Gandha. It's used suitable Anupana, it alleviates the diseases. Vatsanap, Katutikta Kashaya, Ushna Madhura, Jwara Kasa Shwasa Vatarakta. Tankana, it's Katukatu Ushna, Tikshana, Ruksha Saraka, Kafani Sarak, Vata Shamak, Rudya, Vishagna and Pitta Prakopi. Manashila, it's Katu Tikta, Katu Ushna, Snigdha Guru Lekhaniya Kafagna, Kasa Shwasam, Agni Mandya, Anaha, Kandu Jwara and Krumi, Rogagnata. Maricha, it's Katukatu Ushna, Laghu and Tikshna and Guna, and Rogagnata is Kafaja Kasa Kafaja Shwasa, Kafaja Pratishay, Shula, Ajirna Krumigna. Pimpali, it's a dry form, it's Katu, Madura, Anushna, Laghu Tikshna Snigdha, Rogagnata, Kafaja Kshira Shula, Kasa Shwasa, Parshva Shula, Jantugna. Kshunti, Katu Madura Ushna, Laghu and Snigdha, it's Agni Deepan, it's used in Kafaja Kasa, Shwasa, Hikka, Pratishay, Ajirna and Amapachan. How is Shwasakuta are being prepared? Firstly, Shuddha Parad and Gandhak are being murden as in to form a unlustrous, smooth, black, Anjana Sadrusha Kajali. Then one by one, the Shuddha Vatsanap, Shuddha Tankan, Shuddha Manashila are added gradually and Madhudan is continued. As per some of them use the Yog Ratnakar part for the Ekaikam Maricha Datva, or else the Marich that is taken in 8 parts or 7th part. As per the reference, it's added and the Mardhan is continued. The Vanaspati Churna Dravyas are then added, Maricha Pimpli Shunti, and Mardana is continued and it's stored in the glass bottle as was previously mentioned as Kach Kupyam. Matra and Anupan, it varies as per the references. In the Rasendra Sar Sangraha, it's Ushnoda Kanthakari Kvata. Matra is 5 gunjas. Dvitiya part, it's used with a Madhu, Eka gunja. Tritiya, it's 2 gunjas. Yog Ratnakar, it's a Parnakanda Rasa, and Matra is 1 Eka gunja. Rasa Kamadhenu, Parnakanda, Matra, Eka gunja. Bhaishajya Ratnavali, they have given Madhu or Ardhra Karasa Gruta or with a Maricha Churna, half to 1 gunjas. Rasajala Rasa Bhaishyaja Ratnavali has given again second part is Parna Rasa, Ardraka Swarasa, 2 to 4 gunjas. Rasendra Sambhava, 2 gunjas. Rasa Jalanidhi, Parnas Saras and Ardraka Rasa. Rasa Chandanshu Ushnodaka Kantakarik Vata, Matra 5 gunjas. Rasendra Chandanshu second part is just Matra for 2 gunjas. Then Ushnodaka Kshudra Kvata for 5 gunjas, Rasa Yoga Sangraha Parnakanda Rasa 1 gunja, and AFI has given the Anupan as Madhu, Matra 125 to 250 milligrams. The dose of Shwasakuta Ras varies from half gunja to 5 gunjas, but the maximum text has explained the Matra as 2 gunjas, where the dose as the marriage added is 8 to 9 parts in it. Rasa Panchak of Shwasakuta Ras, Rasa is Katutikta, Guna, Ruksha, Tikshna, Vyavai and Vikasi, as it's used in the acute phase of Vega Avasthas, Virya Ushna and Vipaka Katu. After the tablets are formed of a Shwaskutar, now in the market tablet form has been used as they are been given the bhavanas of betel leaf. So tests are organoleptic test, Sparsha Rupa Rasa Gandha, analytically friability, disintegration, hardness, acid insoluble, loss on drying, total ash, alcohol, water soluble, TLC, and the tests of heavy metals are carried. These are some of the market samples of Shwasakuta Ras available. Many of the researchers' paper are available on Shwasakuta Ras. The first is the mercury-based traditional herbomineral formulation. In this, they have given the modern analytical techniques that the Shwasakuta Ras goes through, that is the TEM, XRD, FTINR, and the inductively coupled plasma. Here are some of the pictures as for the X-ray diffraction pattern seen of the Kajali and Shwasakuta Ras. So TEM images of the Shwasakuta Ras. The parameters are loss on drying, acid values. So finally, the conclusion says the present study indicates Shwasakuta Ras is a nanocrystalline with submicron size particle. The titration of Kajali helps in the formation of SGS and increase the crystallinity in the formulation. A systemic review of therapeutic potential of Shwasakuta Ras. The main aim was to present the study to collect the scientific evidence proving that the therapeutic efficacy of Shwasakuta Ras in different diseases. The eligibility criteria carried out was the clinical trial study, pharmacological and animal study, individuals of any age, gender and nationality. Shwasakuta Ras was taken. The conclusion was being an herbomineral formulation in the various classical texts of Ayurveda. It is mainly used in the respiratory systems like asthma, bronchitis, cough and dyspnea. Here are some trials they have carried out. It's a non-randomized clinical RCT controlled device trial, case series and the case reports. The other is clinical study of Shwasakuta Ras in the management of Tamaka Shwasa in bronchial with special reference to bronchial asthma. Material method used, a total 20 patients were taken of age group 18 to 60 in the inclusive criteria. Dose was maintained with 250 milligram with honey thrice a day. After food for the period of 6 weeks, concluded that it shows a 58.80% good results for the relief of signs and symptoms of Kapha Pradhan Samprapti. The second was carried out in our college itself for the Shwasakuta Ras used in COVID-19 infection. So my conclusion was an COVID-19 as a rising problem in the world now. So Shwasakuta Ras might be important in reducing the symptoms. Antimicrobial study has also been carried out. For the time being, the other research papers are compiled as a pharmaceutical studies. They have carried out by adding 8 part of the marriage and the 1 part of the marriage, what the significance is shows with the pharmaceutical doses, the toxicity study, the experimental study, and the bioavailability and the efficacy of the studies. Research article same, the antimicrobial carried out with the Staphylococcus aureus effect of Shwasakuta Ras in Tamaka Shwasa and Shwasakuta Ras shows highly significant relieving symptoms used with the Tambula Patra and also Shwasakuta Ras and Kshirachadi Kashaya in Tamaka Shwasa. A short discussion of the paper presentation. It's a Shwasakuta Ras is a Khalviya Rasayan indicated in the Shwasa Rog. First explained in Rasendra Sar Sangraha of 15th century. Maximum text and the market samples we get have been followed with the Rasendra Sar Sangraha second and third references. Ingredients as we seen have previous one, Vatsanab, Tankan, Manashila and Trikatu as a Katu, Rasa Ushna Virya, Tikshana, Kapha Vatahara, Agnidipan and Kapha Nisara. Marich itself being an antioxidant, antimicrobial, anti-inflammatory, it is an active component we can say in the Shwasakuta Ras. Pimply used as a mast cell stabilizing and antitussive activity. Yog Ratnakar and Rasa Kamadhenu have given a unique method of Shwasakutha Ras. So formulation has importance of Mardhan, the how you efficiently do Mardhan, the efficacy of the formulation increases. So previous study were in many of the previous study research works, adding more marich one by one showed better results analytically, pharmacologically, and clinically. None of the texts have been mentioned any of the liquid media for bhavana of Shwasakutha Ras. So a conclusion is that only it's a Khalviya Rasayan. The most of the quantity differ is the Marich, Pimpri and Shunta in the Shwasakutha Ras, available as in the form of Shwasakutha Ras, Mahashwasakutha Ras, Bruhata Shwasakutha Ras and Shwasari Ras. Marich is the main chief ingredient considered as it varies from 1 part to 10 part. And this is the safe and efficient, effective formulation indicated in Shwasa and Kasa. Yeah, thank you.
Thank you, Dr. Snehal Kulkarni.
Yeah, thank you, sir.
Next is the paper and poster presentation. I would like to invite Dr. Shubhada Rahul Kuge for the paper and poster presentation. Dr. Shubhada, are you there?
Hello, sir.
Hello, doctor.
Hello.
Please share the screen, doctor. You are audible, doctor.
Wait a
Please share
minute.
the screen.
Wait a minute, sir. Sir, can you share my screen, sir? PPT?
1 second, doctor.
Hello.
I'll share for you. Hello, doctor. Please start the session, doctor.
Good evening, everyone. Myself, Shubhada Rahul Bhuge, third year PG scholar, Sallaki Tantra Department, DY Patil Medical Ayurvedic College, Pune. My topic is management of dry eye. Aim of treatment: relieve discomfort, provide smooth optical surface, prevent structural ocular surface damage. Modalities of treatment: preservation of existing tear, reduction of tear drainage, tear substitute, tear any other associated eye diseases which predispose to dry eye. Other options: preservation of existing tear, environmental modifications such as humidification, avoidance of wine, dusty or smoky environment, avoid central heating. Second is lifestyle workplace modification, taking regular break from reading or computer use, lowering computer monitor below eye level, increasing fast blinking exercise, discontinuing medication that exacerbated DED. A small laterally tarsorrhaphy useful in incomplete lid closure. Another one is reduction of tear drainage, done by punctual occlusion, preserve natural tear and prolong effect of artificial tear. Greatest value in severe cases who have not responded to frequent use of topical treatment. Maybe short-term occlusion, otherwise permanent occlusion. Temporary occlusion, collagen plug are used, dissolve in 1 to 2 weeks time. Initially, or 4 puncta are occluded. In epiphora occur, then upper 2 plugs removed. If patient is asymptomatic, then lower puncta are permanently occluded. Reversible occlusion. Reversible prolonged occlusion with silicone long-acting collagen plug that dissolve in 2 to 6 weeks. Problems: granuloma formation and distal migration. Permanent occlusion done in severe cases and repeated should not be done in patients who develop epiphora following temporary occlusion of lower puncta. Young patients, as their tear production tends to fluctuate, done by cautery. Tear substitute. There are some drops available in the market which are used for the dry eyes as a tear substitute. Artificial tear drop use stabilize and thicken precorneal tear film, prolong tear film, DUT, keep ocular surface wet and lubricated, help to repair ocular surface damage, keep ocular surface smooth. Tear substitute is available in the variant form. There is a drop gel ointment. Drop may frequent installation is required. Preservative-free drop are preferable. Gel consists of carbomazole, less frequent installation required. In ointment contains petroleum mineral oil and used at bedtime. Mucolytic agent 5% acetylcysteine drop QID to disperse corneal filament and mucous plug. Eye drop cellulose derivative hydroxypropyl methylcellulose, carboxymethylcellulose, more useful in lipid or mucus deficiency. Appropriate for mild cases. Doses QID and half hourly or 2 hourly. Povidone, sodium chloride, hypromalol, sodium hyaluronate, and polyethylene and proethylene glycol. Treatment of associated diseases, Meibomian gland diseases, blepharitis. In case lead hygiene, warm compression, lead massage, lead scrub, systemic doxycycline, azithromycin, roxystromycin. Correction of lead abnormalities, blepharotosis, logophthalmus. Other options are topical cyclosporin, reduce cell-mediated inflammation of lacrimal tissue, increase in globate cells, reversal of squamous metaplasia of conjunctiva, oral cholinergic drug agent M3 like pilocarpine, cevimeline, effective in xerostomia, and about 40% of KCS patients also obtain relief. Submandibular gland transplantation from extreme dry eye. The DEWS treatment recommendations were based on the modified severity grading. There are different types of grading of the dry eyes depend on the severity. Level 1, education and counseling, environmental management, elimination of offending system medication, preserve tear substitute, allergy eye drop. Level 2, if level 1 treatment are inadequate, add unpreservative tear gels, ointment, steroids, cyclosporin A, nutritional supplement. Level 3, if level 2 treatment are inadequate, add tetracycline, autologous serum tear, punctual plug. After control of inflammation. Level 4, if level 3 treatment are inadequate, topical vitamin A, contact lenses, acetylcysteine, moisture goggle. And surgical treatment, last option is amniotic membrane transplantation, limbal stem cell graft, or keratoplasty. Thank you.
Thank you, doctor. Next is poster presentation.
Yes, sir. My poster presentation topic is keep myopia away, go outdoor and do yoga. For the prevention of the myopia, you mostly prefer the outdoor games or yoga is very helpful to avoid the progression of your spectacle number. More time on ball games, walk, fun at the playground, and other outdoor activity every day. Less time, computer game, mobile, handphone, headphone, and the yogasan which are helpful to prevent myopia is chakrasan, sarvangasan, and halasan. And some eye exercises and meditation are also help to avoid the progression of your spectacle number. Thank you.
Thank you, doctor.
Thank you, sir.
Next is also a paper and poster presentation. I would like to invite Dr. Simran Gani Mulla for the paper and poster presentation. Dr. Simran. Your screen is visible, doctor.
Hello.
Please start the session. Hello, doctor. Your screen is visible. You are audible, doctor. Please start the session, doctor.
Yes, sir. Good evening, everyone. My topic of presentation is use of Narayan Churna in multiple Vyadhi with different Anupana. I'm from college Sumatibai Shaha, Ayurved Mahavidyalaya, Hadapsar, Pune. Introduction. In 13th Adhyay of Chikitsa Sthana, Acharya Charak described Narayan Churna with different Anupana for desired effect. Kalpa described under Adhyay Udhar Chikitsa. The Vyadhi mainly developed due to accumulation of doshas in between Tvaka and Mansa due to Vikrut Vata dosha, which created a space in between Tvaka and Mansa. Prime cause of this Vyadhi is Agnimandya. Narayan Churna mainly effective as Adhomarga Shodhana, that is a Virechan and Vatanuloman. Acharya described Koshta Snehan before using this Churna, as Sneha will help to bring Shakhagata dosha in a Koshta, and then Narayan Churna will eliminate these dosha. Udar Vyadhi developed due to overaccumulation of doshas. Hence, to treat Udar Roga, Acharya described Nitya Virechan Chikitsa. Aim of this study is to study effect of Narayan Churna with different Anupana in Samprapti Bhanga of multiple Vyadhis. Study type is literary review. Narayan Churna, this part is of Acharya Charak. Total 29 dravyas are used in preparation of Narayan Churna in different proportion. All dravyas are basically Ushna and Kapha-Vatagna in nature. Importance of Narayan Churna in Udar Vyadhi is described by the example of God Vishnu. Like Asura Samoha run away from God Vishnu, exactly like that with consumption of Narayan Churna, multiple Vyadhis can be treated. Next part is of Ashtanga Hruday Chikitsa 15 Adhyay. Both parts are same and all Anupanas I'll describe. Guna of Anupan. Anupana is Rochan, Bruhana Dosha Sanghata Bhedan, Tarpana, Mardavakara, Shrama, Klamahara, Deepan, and Shodhan in nature. Shreshta Anupana Dravya is Jala. In Udara Vyadhi, the Anupan with Narayan Churna is Takra. Udar is a Tridoshas Vyadhi, still the Pradhan Chikitsa of Udar Vyadhi is Nitya Virechan and preventing the Jatodak Avastha, as it will become Yapya when it goes to Jatodak Avastha. Then Doshati Matra Upachayat, Sroto Marga Nirodhanat, Sambhavatyam Udaram Nityameva Virechay. Then importance of Takra is described in Udar Adhyay and also in a treatment of Udar. Takra is Srota Shuddhikara, Vata Shleshma Vikara Hara, and Shreshta Kapha Vata Hara. In Gulma Vyadhi, Anupan is Badarambu. Samprapti of Gulma include Tridosha Prakopa, Swayam Margavaroda, causing pain in Hruday, Nabhi, Parshva, Udara, and Basti, then forming a Pinda Swarup of these dosha. Specifically in Kafaja Gulma, Acharya described Virechan. The Badar is Shita, Bhedan, and Shukral in nature. Next is Anaha, Yasya Vata Prakupitaha. कुक्षिम आश्रित्य तिष्ठति नाथो व्रजति नापि ऊर्ध्वम् अनाह तस्य जायते. सुरा गुल्म उदर अर्षोग्नि शोष व्रत स्नेहनी गुरु सुरा अनिलग्नि मेदो अश्रुक स्तन्य मूत्र कफावह. In Vata Vikar, in basically Avarodhajanya Vata Vikar, Prasanna is used. Prasanna is Acha Sura, Gulma Udara Arsha Grahani Shosharut Snehani Guru, Sura Anilagni Medho Sruk Stanya Mutra Kafavaha. Vitsanga. In Vitsanga, Narayan Churna is used with Dadhimanda, Trushna Krama Haram, Mastu Lagu, Sroto Vishodhanam, Amlam Kashayam Madhura, Vrusham Kafa Vatanut, Prahladanam Prinamcha, Bhinatyashu Malam Chagat. Vibandhayukta Arshad Narayan Churna is used with Dadim Ambu. In Vibandhayukta Arsha, use of Dadim Ambu is already described in in this sutra, Yamani Nagaram Patha, Dadimasya Rasagudam. Dadim has two type like Madhura and Amla, and which is three doshagna, Madhur Amla Kapha Vatapaham. परिकर्तिका परिकर्तनाकारा वेदना वृक्षाम्ल आम्लोष्ण वातग्न कफ पित्तलम पक्वम तु गुरु संग्राही मधुर आम्ल रसम तथा अल्पोष्णम रोचनम वृक्षम दीपनम वातनाशनम तृष्णार्षो ग्रहणी गुल्म शूल हृद्रोग जंतुजेति. Ajirna. In Ajirna, Narayan Churna is used with Ushnambu. Ushnambu is Deepan, Pachan, Kantha, Lagu, Ushna, and Basti Shodhan. Hidma, Adhmana, Anila, Shleshma, Sadhya Shuddhi in Navajwar. Kasa Ama Pinasa Shwasa, Parshva, Rukshacha, Shastate. Discussion. The dravyas used to prepare Narayan Churna are Ushna in nature and having Kapha Vatagna effect. The principal effect of Narayan Churna is Sneha Paschat Virechan. Narayan Churna basically works on Avarodhajanya Samprapti, Apanavayu Dushti, which further leads to Agni Mandya and Sruturud. Conclusion. Narayan Churna is Adhomarga Shodhana Kalpa, which leads to Avarodhajanya Samprapti Bhanga with the help of different Anupan Gunam. Thank you.
Thank you, doctor. Next is a poster presentation.
Okay, sir. ये करो ना poster. Topic of poster presentation is a review of literature of Shatadauta Gruta from Dattatray. Introduction. Shatadauta Gruta is tropically used Ayurvedic preparation. Aims and objective to study use of Shatadauta Gruta in different Vyadhi as per Samhita Granthas. The Shatadauta Gruta is prepared by washing cow ghee in 100 times with water. Use of Shatadauta Gruta in a Garbhastapana Vidhi, application of Shatadauta Gruta around umbilicus, described in Charak Viman and Ashtanga Hriday Sharyasthan. In Rajayakshma, for Daha, Abhyanga with Shatadauta Gruta in Charak Chikitsa and Ashtanga Hriday Chikitsa. Shira Parshva Shula, for treatment of Shira Parshva Shula, described in Ashtanga Sangraha. In Trishna, Charak Chikitsa 22, after Jalokavacharan for Raktasthamban, described by Sutrastan. In Bhagna, Sushrut Chikitsa Sthan, Pitta Pradhan Vatarakta by Sushrut Chikitsa and Ashtanga Sangraha Chikitsa. Raktaj and Pittaj Vrana, Charak Chikitsa and Ashtanga Hriday Uttarstan. Khanda Ushta Lekhan Paschat Karma by Ashtanga Sangraha. Arsha and Atisar for Raktasthamban, Charak Chikitsa 14 and 19th Adhyay, and for Budadaha Ashtanga Sangraha Chikitsa. In Visarpa, Charak Chikitsa 21 and Ashtanga Hriday Chikitsa 18. Discussion. This procedure, like washing cow ghee 100 times with water, transform ghee into soft, cooling, nourishing, and silky ointment. The samskar is a procedure of adopting gunas. Cow ghee become more pitagna and sheeta in nature due to washing with water 100 times. Thank you.
Thank you, doctor. Next is a paper and poster presentation. I would like to invite Dr. Poonam Deshmukh for the paper and poster presentation. Dr. Poonam Deshmukh, are you there?
Yes, sir.
Okay, doctor, please share the screen, doctor.
Is it visible, sir?
Yes, doctor, visible doctor. Please chat.
Yes. Good evening, everyone. This is Dr. Poonam Deshmukh, BMS MD scholar, second year from Samhita Siddhanta Department, SSM, Head of Cell, Pune. The topic of my presentation is Vaman Karma. I have took references from Charak Samhita, Sushruta Samhita, and Ashtang Hrudaya. Introduction is Tatra Dosha Haranam, Urdhva Bhagam Vaman Sadnyakam. It means elimination of dosha through upper part of body is called as Vaman. Apakva Pitta Shleshmano Balat Urdhvam Nayattu Yat Tati Vidnayam. Means Vaman is a procedure that forcibly carried the Apakva Pitta and Kapha in upward direction. It is the first Panchakarma procedure advised in human being. That is the cleaning of newborn baby's mouth with sendap and circuit. The types of Vaman, first one is Sadhya Vaman, then Snehapurvak Vaman, and another is Mrudu Vaman, Madhya Vaman, and Tikshna Vaman. The dosh include Vaman is Kapha dosh and Kapha Pradhan dosha sayog, then Rutu is Vasant Rutu, then composition of Mahabhuta is Vayu and Agni Mahabhut, then direction of Vamak Dravya, that is Urdhva Gati, upward direction, then properties of Vamak Dravya is Ushna, Tikshna, Sukshma, Vyavayi, and Vikasi. Then Vaman Dravya, according to dosha, according to in Kapha dosha, it is Tikshna, Ushna, and Katu. For Pitta dosh, Madhur, Sheet Dravya. For Vata dosh, it is Snigdha, Amla, and Lavan Dravya. Then Vamya Rog, there are Vamya Rog, according to Charak, Shushruta, and Vagbhatacharya, there are a lot many due to lack of time. I'll take it in short, like Penis, Kushta, Navajvar, Raja, Exma, Shwas, Kas, etc. Avamya Rog, that is Shatakshin, Ati Sthul, Ati Krush, Bala, Vruddha, Durbal, Shranta, Pipasit, Kshudit, Karmahat, Bharahat, Advahat, Upasit, Maithun Prasakta, Adhyay Prasakta, Mutraghat, Plihadosh, Gulma, Udar, Ashtila, Swaropaghat, then Shankha, Shirashul, Karnashul, Akshushul, Nitya Dukhi, etc. Vaman Kalpa, in Charak Sutrasthan 4, there are 600 Virachan Ashraya are mentioned. According among them, 355 are Vaman Yog and 245 are Virachan Yog. Charakokta Vamak Dravya, that is actual vomiting inducing Dravya, are divided into Mulini and Palini. That is Mulini, Hemavati, Shanapushpi, Bimbi. Then Palini contains Dhamargyo, Ikshvaku, Jemuta, Krutvedan, Madanpal, Kutaj, Trapuj, Hastiparni. Then there are 10 Vamanopag. 10 Dravya are included in Vamanopag Mahakashaya, that is other helping Dravya for Vaman. They are Madhu, Madhu, Kovidar, Karbudar, etc. Then Madanpal, Vamane Madana Shreshta. Madanpal is the Shreshta medicine for Vaman. Its Latin name is Randia dumentarum, English name is emetic nut. It has some synonyms like Marujak, Maruvak, Rat, Shallak, Shalla, Pindipal, Pindita, Golfal, Granthipal, etc. The collection of Madanpala, it has been done in the mid of Grishma and Vasanta Rutu. When it is peaking, no, it should be not too yellow and not too green. Then put it in a container made with a kusha and coat it with cow dung. Then keep it in grain for 8 days. When the fruit begins to ripe, it will give you sweet smell. Then take this out and dry it in sun. Then take out its bija pipali, mix it with curd, honey, ghee, etc. and dry it again and store it. So doses for Vaman Aushadhi. The dose of medicine differ from man to man. So it should be given in quantity that removes the dosha and does not result in any ayog or atiyog that leading to any harm. But according to acharyas, so according to Shushruta, it is depend on the dose of Vaman Aushadhi is depend on Vyadhibal, Purushbal and Agni. According to Vagbhata, it depends on Vyadhibal, Vaya, Koshta, Desh and Kal. According to Charkacharya, if used in small quantity, it should remove the maximum dosha. It should bring the appropriate amount of vega in Vaman. It includes Sukhapurvak Vaman. It induces Sukhapurvak Vaman and is able to cure disease without causing other disorders. Its Gandha, Varna and Rasa should be suitable for consumption. Then Vaman procedure, the pre-operative procedure, we are divided into 3 parts, the pre-operative, operative and post-operative. That is pre-Vaman, Vaman and post-Vaman procedure. So pre-operative is a Snehan for 3 to 7 days Snehan until get the Samaksnigdha Lakshana, then Swadan giving steam. A day before Vaman, fish, urad dal, sesame seed, etc. or kapha utkleshak diet should be given. Then ask the patient to take the rest. And on the day of Vaman, in the morning after checking Jirna avastha of the patient, Nirantaram Ishada Snigdam Peya Pita Sarpisham giving. Then let's move toward the main procedure of Vamana. First of all, chanting Shloka. Then give Vamana Aushadhi to the patient. And as the Lala Stav starts, use the finger or castor or lotus stem to induce non-induced Vegas. As soon as the Vegotpati starts, the patient should sit on the chair as high as his knees. The Paricharak should hold the patient Parshva and Lalat Sthana. Then compression should be given on Nabhi and Prushta in upward direction. While conducting Vaman, a chart should be maintained by a Vedda which contains serial number, type of medicine given, quantity of medicine, number of Vegas, and Lakshana of patient, etc. The type of Vaman Shuddhi. There are three types of Vaman Shuddhi, that Jaganya, Madhyam, and Avar Shuddhi. It's Vega and Matra. The Vegas in Jaganya are 8, Madhyam 6, Avar 4. The Matra of emitted Dravya in Jaganya 2 Prastha, Madhyam 1.5 Prastha, Avar 1 Prastha. Then post-operative, post-Vaman procedure, clean the patient face and hand, reassure the patient and ask him to take the rest. Then Dhumpan, conduct the Dhumpan. After that, follow the Payadi diet from evening. This is the Payadi diet, that is post-Sansarjan Kram. Then Samyak Lakshan. After Vaman, you should check the Samyak Lakshana in the patient, that is Kale Pravrutti, Kapha Pritta, Vat Yata Kram Nirharan, स्वयं अवस्थान, हृदय शुद्धि, पार्श्व शुद्धि, मूर्धा शुद्धि, स्त्रोत शुद्धि, इंद्रिय शुद्धि, लघुता, कार्श, दौर्बल्य, कंठ शुद्धि, कप संस्राव स्थिति, अनति महति व्यथा. Then some असम्यक लक्षण like वेग अप्रवृत्ति, केवल औषध प्रवृत्ति, वेग विबंध, हृदय अशुद्धि, स्त्रोतस अशुद्धि, गुरु गात्रता, स्फोट, कोट, कंडू, कप प्रसेक and ज्वर. Then अतिवमन लक्षण are फेनिल वमन, रक्त चंद्रिका युक्त वमन, तृष्णा, मोह, मूर्छा, वात प्रकोप, निद्राहानि, बलहानि, हृत पीड़ा, कंठ पीड़ा, तम प्रवेश, भ्रम, Daha, Mrityu, to be verified by 4 ways, that is Vegiki, Antiki, Maniki, and Langiki Lakshanam. So we have seen the Vegiki and Maniki Lakshane in past slides. Now see Langiki, in Jaganya Shuddhi, all symptoms are present. In Madhyam Shuddhi, some moderate amount of symptoms are present. In Avar Shuddhi, few symptoms are present. And Antiki, it should be Pettantik Vaman. Vaman Karmukta, how does an actual Vaman process takes place in human body? Administration of drug. As soon as drug entered in the stomach, it with the help of blood vessels, artery veins, it enters into heart. From heart, it enters, spreads all over the body. There, the liquefaction of dosha and toxins takes place. These dosha or toxins detach from dhatus. Then Roma Harsha can be seen on a body. Then these dosha or toxins are again microphiles and enter in the stomach. At the time, we can see the adman in the patient. After that, the ullas, that is nausea started, and after that, Vaman takes place. Some researches regarding Vaman karma shows the vomitus contain abundant mucopolysaccharides. What is mucopolysaccharides? These are the long chain of sugar molecule that are found throughout the body, often in mucus and in fluid present around the joints. Then the next, some small quantity of stercobilinogen is present. Stercobilinogen is a chemical that is created by bacteria in the gut. It is made up of broken down hemoglobin. Then some histamine is also present in a vomitus content. Histamine is a chemical that found in some of the body cell that causes the many of symptoms like allergies such as running nose and or sneezing, etc. The discussion and conclusion. The discussion is a Vaman Vidhi is also known as therapeutic MSCs. It is a procedure used in eliminate excess kapha dosha from body. During this process, specific herbs and formulation are administered to induce vomiting and eliminate toxins. Vaman Vidhi is primarily indicated for condition related to excessive kapha dosha. Research and clinical studies have shown promising result in managing many diseases such as respiratory disease, allergy diseases, skin diseases. It aims to restore the balance of dosha and improve the overall health. The conclusion of the study is the Vaman Vidhi is a therapeutic MSC procedure. It is valuable therapeutic tool in Ayurvedic medicine for managing conditions related to excessive kapha dosha. Through controlled vomiting, Vaman Vidhi aims to eliminate toxins and balance the doshas. It has shown positive outcome in various respiratory and skin disorders. However, its application should be done under the supervision of experienced Ayurvedic practitioner, considering individual suitability and contraindications. Thank you. Hello.
Thank you, doctor. Next is a poster presentation.
Is it visible, sir?
Yes, doctor. Visible, doctor.
Okay. The title of my poster is a Grishma Ritu Charya, that is Ayurvedic guideline for summer. Introduction: Grishma Ritu is also known as the summer season. It is the hottest period that falls from May to July. As per Ayurveda, Grishma Ritu is one of the 6 Ritus and the last season of the Adan Kal. The time of the year when the sun is in northward position of the earth. Grishma Ritu falls between Vasant Ritu and Varsha Ritu. So aim and objective of my study is to study the Grishma Ritu Charya and to study the Ayurvedic guideline for summer. As we have seen, it lasts from mid-May to mid of July. The earth atmosphere becomes more dry and hot. Then depletion of ojas from body takes place. The patient or normal human being feel increasingly tired and restless. Kapha in our body gradually weakens and vata aggregates. Then impairment of digestive process takes place. Due to impairment of digestive process, the body absorbs little nutrition from the food. That's why the dhatu becomes very weak and body becomes weak. So there are some do's and don't in this Ritu Charya. In do's, it has said the Snigdha, Shita. You should have Snigdha, Shita and Laghu Bhojan. Add desi cow ghee in your regular diet. Then have fruit juice, coconut water, sugar cane juice, freshly made juices. Then have meat soup. Wear flowers in hairs or use garland. Then madhur laghu food. Then have lassi or buttermilk in your food, in your diet. Then add plenty of liquid food. Then wear white colored clothes. Then use boiled and cooled water that is kept in an earthen pot. Then use pitta balancing hair lepas, hair mask. Then pada abhyanga on regular basis. Then spend your evening or night on terrace. Use prefer white colored rice and bath using cold water. Some don'ts: that are avoid UV rays, that is direct sun. Avoid brown or black or
Hello, doctor. Hello, Dr. Poonam Deshmukh. Okay. Next is a poster presentation. I would like to invite Dr. Sonali Sanjay for the poster presentation. Dr. Sonali Sanjay, are you there?
Yes, sir. Yes.
Okay, doctor. Please share the screen, doctor.
Is it visible, sir?
It's Dr. Visible, doctor. Please start the session.
Yes. Firstly, I will introduce myself. Myself, Dr. Sonali Sanjay Gandhi. I'm a PG scholar student of the CRC Pune, and my topic is a literature review on the Balatisar according to the Ayurveda, guided by the Sudhasan. But diarrhea is described in the Ayurvedic text as a Atisara. The term Atisara is derived from the two words, that is, Ati is excessive and Saran is Saran means flow. Condition where water is stored fast in the excess with the high speed. Atisara is a disease of intestinal disturbances, involves the water and electrolyte imbalances. Malnutrition. Atisara not only affect the health of the children, but it is considered responsible for the infant mortality, especially in the tropical and subtropical countries. It is described in our Charak Samhita as a Atishayana Sarayati Rechayati iti Atisara. Balatisar affects large number of population worldwide, and prevalence of the diarrhea nowadays reducing the school performances of many children. I've collected this data from the Ayurvedic literatures, contemporary medical textbooks, including the website, reviewed and documented for the intended study. Samanya Nidana are the Ati Guru, Matra Guru, Ati Snigdha Ahara, Ati Ruksha Ahar, Dushit Jalapan, Ati Madhyapan, Viruddhashan, Adhyashan, Aparikapashan, Visham Bhojan, Ayog, Asthapan, then Bhaya, Shoka, and Upadravaru. There are 7 types of Atisara: Vatash, Pittash, Tapat, Sanipatash, Bhayat, Shokash, and Raktash. Treatment is given according to the condition, Amatisar condition or a Pakwatisar. In Amatisar, Ama, first of all, one should abstain from the food and take digestive remedy. Thereafter, at the end of fasting, light and thinly liquid diet should be taken. Bowel binding, that is Sangrahi therapy, should be avoided as there is in the body. So Deepan Pachan should be given. In the Pakwatisara, there is a laxity of the Grahani increase. So immediate treatment should be given. There is a conclusion, that is Atisara is the disease of GIT, and that it has the Aharas and Viharas Nirvana. Its Samprapti involves the vitation of the Vata dosha and Apadhatu along with the Agni Mandya and Maladravita. It occurs mainly due to the unhygienic condition. That's why it is found more in the children of the low socioeconomic status. As its Samprapti involves the Agni Mandya and Maladravita, and Ayurvedic formulation used in its treatment usually have the Deepan and Pachan Grahi properties. This formulation increases the appetite, so reduce the Agni Manda, and due to the Pachan properties, it decreases the Ama formation. The Grahi property of the Ayurvedic formulation helps in reducing the frequency of stool due to the Shoshan. The various food recipes advised in the Atisa according to the Ayurveda, such as Peya, Manda, etc., helps in replacement of ongoing water loss and electrolyte imbalance. So Ayurvedic formulation mainly act by breaking the Samprapti of the disease. Thus, Ayurveda offers various treatment modalities for the management of symptoms of Atisara as well as preventive aspect of Atisara by the Nidan Parivarjan. There are some formulations given in our Samhitas like Ashtachari Gutika, Karpurati Vatika, then Jati Falagya Churna, Balak Chaturbhadra Churna. And in the Shokas and Bhaya Atisa, treatment given is Vata Hara Chikitsa and Ashwasana and Harshan Chikitsa. Thank you, sir. Hello.
Thank you, doctor.
Thank you.
Next, I would like to invite Dr. Avinash Katti for the paper presentation. Dr. Avinash, are you there? Hello, Dr. Avinash, are you there? Hello, Dr. Avinash.
Hello, sir.
Hello, Dr. Avinash. Dr. Avinash, please. Hello, Dr. Avinash. We can't hear your voice, doctor.
Hello.
Hello.
Sir. Sir, am I audible?
You are audible, doctor. You are audible. Please share the screen, doctor.
Yes, sir. Is it visible, sir?
No, doctor, not visible.
One minute, sir. No, sir.
Now visible, doctor. Please start the session.
Okay, sir. Good evening, everyone. Myself, Dr. Anesh, second year PG scholar from Department of Commerce, Alvas Ayurveda Medical College, Mount Bidre, guided by Dr. Jitesh Chota, Associate Professor. Department of Comorbidity, Alas Ayurveda Medical College, Mudubidri. My topic is on a review on action of Kruta in conduct disorders. These are my contents. Introduction, conduct disorder, signs and symptoms, introduction of Kruta, discussion and references. Introduction. Conduct disorder is a repetitive and persistent pattern of behavior in children and adolescents in which the rights of others or basic social rules are violated, either aggressive or non-aggressive manner. Conduct disorder is more common in boys than girls. Current data states that the prevalence of conduct disorder is from 2% to 5% in children, and that is age between 5 to 12 years, and 5% to 9% in adolescents between 18 to 13 years, 13 to 18 years. Grita can be used in management of conduct disorder in children. Ayurveda classics mentions that the Grita acts as rasana and does Vata Pitta Shamana, Kapha Vardhaka, Medhya and Balya. Formulations like Brahmi Grita, Kalyanaka Grita can be used in treating conduct disorders. Now, what is the conduct disorder type, symptoms and causes of treatment? The child or adolescents usually exhibits these behavior patterns in a variety of settings, at home, at school, and in social situations, and they cause significant impairment in his or her social, academic, and family functioning. The types of conduct disorders are mainly three types, that are childhood onset, adolescent onset, and unspecified onset. In childhood onset, it is occurs in between below age 10 years, and adolescents in teenage in age conditions. Unspecified is the cause is not specifically found. Behaviors characteristics of conduct disorders includes aggressive behavior, non-aggressive behavior, deceitful or theft, so serious rules violations. In aggressive behavior that causes threatens harm to other people or animals, such as bullying or intimidating others, often initiating physical fights or being physically cruel to animals. Non-aggressive conduct that causes property loss or damage, such as fire setting or deliberate destruction of others' property. Deceitful or theft, such as breaking into someone's house or car, lying on cunning others. So, serious rules violations such as staying out at night when prohibited, running away from the home overnight, or often being thrown from school. Introduction to Grita. Now, before I have explained about all about conduct disorders, now is about Grita. Properties and conduct indications of Grita are mentioned mainly in Ashtanga Hridaya Sutrasthana 5th chapter and 16th chapter. Shloka number as in 5th chapter 37 to 40, in 16th chapter 8 shloka. Charaka Samhita Sutrasthana in 13th chapter 14th shloka. In Sushrata Samhita Chikitsana 31st chapter 4th shloka and 45th chapter 108 to 111 shloka. Kashyapa Samhita Sutrasthana 22nd chapter and 23rd chapter. In 22nd chapter 6th shloka and 23rd chapter 25th shloka. Introduction. The explanation about Grita is Grita is Madhur Rasa, Saumya, Mrudu, Guru, Anabhishanda Guna, Shita Virya and Madhura Vipaka. Dosha, Vata Pitta Prashamana, Kapha Vardhaka. Karma, Snehana, Agnidipana, Balakara, Ayushya, Rushya, Medhya, Vayastapana and Chakshusha. It pacifies Vata and Pitta and cures Visha, Unmada, Shosha and Alakshmi. Desires to wisdom, proper function of sense organs, power of digestion, intelligence, nourishment, etc. Principles of treatment in children according to Kashyapa Samhita is they should be treated only by Ashana, Lepa, Sechana with those drugs which are Snigdha, Shita, Madhura and do not produce burning sensation. The drugs should have these qualities like Snigdha, Shita and Madhura. The correlation between modern and Ayurveda is that criteria aggressions to people and animals is Mano Vibrama, Buddhi Vibrama, Chesta Vibrama and Anavistita Chitatva. Destruction of properties may correlated to Shila Vibrama, Chesta Vibrama, Achara Vibrama. Deceitful or theft is related to Chesta Vibrama and Achara Vibrama. Serious violations of rules can be correlated to Chesta Vibrama, Achara Vibrama and Smriti Vibrama. Discussion, action of that Grita with conduct disorders. In conduct disorders, mainly Vata is increased due to Ratri Jagarana, night roaming and everything. Violations of rules. In aggressive behaviors, Pitta is increased due to angry and blaming others. These all symptoms are found in conduct disorders. We observe in conduct disorder. According to Kashyapa, 27 Sutrasthana 27 chapter 66 shloka, Aushadha should be contained Snigdha, Shita and Madhura gunas in the management of disease in children. According to Charaka, practicing Achara Rasayana can reduce the symptoms of conduct disorders. In that, Grita is mentioned to take daily. In children, Kapha is in Pradhana Avastha due to Vata Pitta Prakopa. Psychological and physiological changes are seen. Grita is best option to normalize the vitiated doshas. Ghruta contains Prithvi and Jala Mahabhuta, which helps in promotion of strength and nourishment of the body. Ghruta contains Snigdha Guruguna, which helps to mitigating the Vata dosha and maintaining the Kapha dosha. Ghruta has Madhur Rasa, which is Saptadhatu Ardhaka, Indriya Prasadaka, Rasayana, Smriti, Buddhi, Agni, Shukra, Oja, Vardhaka, etc. By applying the similar theory of similarity, that is compared with the Mastishka, which resembles the molten ghee, can be supplemented with clarified butter in various therapies. Ghruta is striking that efficacy in crossing BBB, that is blood-brain barrier, which is very much needed for the treating of mental anomalies. Lipid-soluble drugs are rapidly distributed throughout the intra and extracellular spaces. The drugs which that are rapidly absorbed from the gut because of their lipid solubility are known as readily diffuse into the CSF and the brain. The main reason is the molecular structure of the blood-brain barrier. For better efficacy of various psychotropic drugs given in the form of Ghruta in CNS diseases, its antioxidant properties prevent the oxidative damage of brain and other tissues of the nervous system, thus providing protection from various degenerative diseases. Ghruta is one of the most effective drug dosage forms used for neurodevelopmental disorders. These are my references. Thank you, sir.
Thank you, Dr. Avinash.
Thank you.
Next, I invite Dr. Nisarga for the paper presentation. Dr. Nisarga, are you there?
Yes, sir. Yes, sir.
Nisarga, please share the screen, doctor.
Just a minute, sir.
Your screen is visible, doctor. Please start the session.
Okay, sir. Good evening, everyone. Myself, Dr. Nisarga, third year PG scholar, Department of RSBK from A.L.N. Rao Ayurvedic Medical College, Koppa. Introduction. We all know Rasashastra is a science which deals with the usage of metals, minerals, gemstones, and poisonous substances to treat diseases and convert the lower metals into higher one. Before the metals and minerals are used for therapeutic benefit, they need to undergo a mandatory process known as Shodhana. The word Shodhana in Ayurveda denotes purification. In Rasashastra, the word Shodhana refers to the purification of the metals, minerals, or the toxic substances which are used for therapeutic benefits. It helps to remove physical, chemical, or toxic impurities from metals and minerals and make them for therapeutic uses. Definition. Uddishtai raushadai sardam kriyate peshanadikam malavichate yettu shodhanam tadiyocchate means it is a process in which Shalana, Mardana, Bhavana, Svedana, Parjana, Nirvapa, etc. are carried out on mineral drugs with a view to eliminate impurities. Aims and objectives. Aims. There are different aims on Shodhana. It varies from drug to drug. Some of them are, example, for Tankana, frying helps to reduce the intensity of astringent taste. For Kampillaka, Prakshalana helps to remove dust and make free from insect. For Rasona, Nimajjana helps to reduce Tikshnatva. Objectives. Elimination of physical and chemical impurities, neutralization of toxins, to induce and enhance therapeutic qualities, to impart organic qualities, to make metals and minerals suitable for administration, to facilitate further process like Marana, Sattvapatana, and Lohitikarana. Eliminates physical and chemical impurities means as most of the drugs mentioned in Rasashastra are naturally available, they may contain many adulterants like stone, sand, mud, etc. Such foreign matter should be removed by the process of Shodhana. Example, Shilajatu Shodhana. As per classics, to separate physical matter, Shilajatu has to be washed from alkaline liquid medium or sour liquid medium or cow's urine. Parada Shodhana, it is known fact that mercury contains Naga and Vanga, which are obviously used as nil adulterants. They are chemical impurities, can be removed by a special process known as distillation. Next point, neutralize the toxins. Though the drug is free from physical and chemical impurities, most of the drug of Rashastra are toxic in nature. The unpurified drugs like Gandhaka, Tamra, Haratala, Manashila, Gauripashana, etc. Certainly, these drugs produce some toxic symptoms on administration even when they are physically and chemically pure. Probably the drugs what we use as a purifying agents for the process of Shodhana have such unique qualities which will neutralize the toxicity of these drugs. Hence, these drugs, it is mandated to undergo the Shodhana process. Next point, enhance the therapeutic qualities of the drugs. Whatever the drugs are being used in the process of Shodhana, may it be herbs or animal products, and they themselves act as a catalytic agent. These herbs and animals products can bring some desired changes in the drugs. Ayurvedically speaking, these changes can be identified as Gunantaradhana. Example, Gandhaka Shodhana. In Gandhaka Shodhana, Gandhaka is melted with appropriate quantity of cow's ghee and poured into cow's milk through a clean cloth. Here, this particular method has been focused on physicochemical impurities and also on toxins. Same time, cow's milk and cow's ghee enhance the pharmacological properties of the sulfur. Next point, makes the metals and minerals suitable for further process. Most of the metals and minerals are basically hard in nature. They are to be administered in suitable form. These hard metals and minerals have to be converted into Basma form by the process of Marana. So here the Shodhana plays a very important role by imparting brittleness and softness. Obviously, by this process, which easily facilitates and fastens the process of Basmikarana. And Shodhana is highly beneficial in further process like Marana, Sattvapatana, Loitikarana, etc. Brings organic qualities means the aim of Rashastra is to convert diseased body into healthy body, that is Dehavada. Most of the drugs in this science are inorganic in nature. It is known fact that the living beings are organic in nature. So it clearly indicates that it is highly impossible to administer in their natural form. Hence, during purification process, herbal drugs not only nullify the toxicity and modifies the active principles, but also brings organic qualities, which is highly necessary for administration. Coming on to classification, Shodhana is mainly classified into two types, Samanya Shodhana and Vishesha Shodhana. Samanya Shodhana means general method of purification and Vishesha Shodhana means a specific method of purification. Samanya Shodhana, it is generally applied for the drugs which are come into one category like Maharasa, Uparasa, Ratna, Dhatus. The drugs of one group having similar types of impurities. So that with the help of Samanya Shodhana, general impurities can be removed. Examples, Dhatu Samanya Shodhana. Vishesha Shodhana, it is specifically applied for the drugs which contain high concentrated chemicals. Each drug of the group may have different type of impurities, which are vary from substance to substances, are removed by Vishesha Shodhana. One more classification of Shodhana is Sagni Shodhana and Niragni Shodhana. Sagni means with fire and Niragni means without fire. Example for Sagni Shodhanas are Nirvapa, Dalana, Barjana, Puta, Sveda, Patana. And example for Niragni Shodhanas are Bhavana, Prakshalana, Shoshana, Sinchana, Nimajjana, Garshana. These are all different procedures of Shodhanas and of pharmaceutical actions. Svedana means vaporization of raw drug in a certain liquid material. Mardana means trituration with Swarasa, Kashaya or Godugda or Gomutra. Murchana means trituration up to the fine disintegration. Patana means by giving heat to substances so that it vaporizes and the extract is collected. Avapa means melting solid raw drug and dipped in cold liquid. Nirvapa means eating solid drug and dipping in cold liquid. Galana means filtration. Prakshalana means to clean or proper washing. Nimajjana means keeping raw drug in a certain liquid for certain time. Barjana means to fry or to dehydrate. Samyoga means addition of a drug into another drug. Vibhaga means separation of unwanted part. Pachana means Shodhya Dravya immersed in the Shodhana Dravya and keeping on fire. Shoshana means drying in sunlight or moonlight. Sinchana means sprinkling liquid on hot drugs. Stapana means keeping Dravya in stable condition. Moving on to discussion, By nature, the drugs of alchemy do contain lot of impurities and toxic. So these are extremely toxic and fatal if administered in their crude form. Hence, Shodhana is a preliminary step towards therapeutic administration. Shodhana is a process in which physical and chemical impurities and toxins will be removed. Historically, the detailed description of Shodhana can be traced in Rashastra text and got developed immensely during medieval period, that is 8th century onwards. Also, we can see their types, duration, the drugs are being used, instruments, utensils during the process. This shows that the seers of alchemy had immense knowledge about the purification and their mode of administration. Perhaps very few drugs can be administered immediately after Shodhana. Examples like Gandhaka, Gairika, Kankshi, etc. The process of Shodhana makes the drug suitable for further process like Marana, Satvapatana, Lohitikarana, Amrutikarana, etc. Certainly, we can understand that there is a strong rationality between the method, duration, instruments, and the drug which are being used in the process of Shodhana. Coming to conclusion, Shodhana may remove physical and chemical impurities. It brings organic qualities. The drug which are being used in the process of Shodhana may be modify the active principles and enhance the therapeutic action. Thank you.
Thank you, Doctor. Next, I invite Dr. Rajat Sharma for the paper presentation. Dr. Rajat Sharma.
Hello, yes, sir.
Hello, Doctor. Please share the screen, Doctor.
Okay, 1 second, sir.
Your screen is visible, Doctor. Please start the session.
Yes, good evening, everyone. Myself, Dr. Rajat Sharma from the Department of Pharmacopoeial, second year PG scholar. Today, presenting my topic on a review on action of Brahmigrita on ADHD with respect to Aamvata under the guidance of Dr. Jitesh Chonta, Associate Professor. Introduction. ADHD is a chronic condition including attention difficulty, hyperactivity with symptoms of impulsivity and inattention. Secondary symptoms like insomnia, learning disability, delayed language development lead to changes in cognitive, academic behavior, emotional, and social functioning. ADHD prevalence is more in boys, about 66.7%, and in girls, about 33.3%. Current data states that the prevalence of ADHD is 11.32% in school-going children, 2.4 in 2 to 5-year-old children, and 9.6% in 6 to 11-year-old children. Psychiatric and behavioral disturbances are discussed under Aamvata Roga in Ayurvedic classes. Cardinal features of Aamvata are related to emotional, behavioral, psychological, and physical disturbances due to imbalance of three doshas. Ayurveda mentions that Brahmigrita act as a medya. Brahmi and Sanpushpi are present in Brahmigrita, and these are proven to be having best result in behavior disorders and psychological problems. Hence, I made an attempt to review an action of Brahmigrita in ADHD with respect to Aamvata. ADHD sign and symptoms. Poor attention span with distractibility, shifts from one uncompleted activity to another, easily distracted by external stimuli, talk excessively, interfere in other people's activity, act before thinking, forgets things randomly. According to Acharya Charka, Aamvata is one of the Manas Vyadhi, which is understood as the unsettled condition of the Manas, Buddhi, Sanjana, Gana, Ganan, Samriti, Bhakti, Cheshta, and Achar. In Ayurveda, disorders related to psychiatric and behavioral disturbances are discussed under healing of Aamvata. This is due to imbalance of three doshas. Brahmigrita is an Ayurvedic polyherbal formulation that contains 4 major rasayana: Brahmi, Kusht, Sanpushpi, Gogritam. Out of this, Brahmi and Sanpushpi have been earlier evaluated in different behavioral disorders and has been shown promising results. Brahmigrita is one of the important grita preparation that is widely used in Manasik Vikaras. It can be used as both Shaman and Shodhan Abhyantar Sneham. Its main content is Brahmi, thus conferring its name. Brahmi Grita can be used in the management of ADHD in children. Ayurveda classes mention that Grita acts as a rasayana and does Vat Pitta Shamna, Kaf Vardhana, Medya, and Balya. Formation like Brahmi Grita, Kalyanak Grita can be used in treating ADHD. Raspanchak. Part use. Whole plant of Brahmi is used in this. Dosage 1 pala to 4 pala. According to Kashyapa, Osha should contain Snigdha, Sheet, Madhur, etc. gunas in the management of diseases in children. In ADHD, Vata is increased. In aggressive behaviors, Pitta is increased due to anger and blaming others. Actually, in children, kapha should be predominant, but due to vata pitta prakopa, kapha is reduced. So grita can be used in this because it is kaf vardaka and vata pitta sham. According to Chark, practicing achar rasayana can reduce the symptoms of ADHD. In that, grita is mentioned to take daily. Brahmi justifies its use as a pinnacle drug to treat a wide variety of health problems since time immemorial. Innumerable experimental and clinical investigations have demonstrated its significant role in enhancing memory and uplifting cognition, promoting brain repair, anti-anxiety, wound healing, anti-stress activities. Clinical trials have proven its effectiveness in supporting treatment for ADHD and mental retardation. It is most commonly used as a nervine tonic that enhances learning and academic performances, improves mental alertness, sharpness, short-term and long-term memory, rectifies speech disorders, increases concentration and intellectual ability in children. In today's modern era, day-to-day psychometric disorders affecting children are increased in pediatric clinics. Out of that, ADHD is one of them. Due to increased distractibility and difficulty sustaining attention, poor impulse control and decreased self-inhibitory capacity, and motor overactivity and motor restlessness, etc., lead to this disease. Psychiatric disorder is well explained in Ayurvedic Samhita that ancient knowledge of Ayurveda will help in diagnosing and management of Unmada in present era very well. In Ayurveda, it may be correlated to Unmada disease, which is Vatic Vikara. So line of treatment according to Vatic disorders such as neuroprotective medications along with Panchkarma therapies have definitely shown outcome on the disease and thus pave way to further researches in employing Ayurvedic methods toward the management of ADHD. In modern medicine, except presynaptic demographic antagonists, there is no other treatment for the disease, while traditional life sciences Ayurveda has more effective solution over this. So it is an attempt to review an action of Brahmigrita in ADHD. These are my references. Thank you.
Thank you, Dr. Rajesh Sharma. Next, I invite Dr. Saujanya for the paper presentation. Dr. Saujanya, are you there? Dr. Saujanya Jay, are you there? Dr. Saujanya, please unmute, doctor. Dr. Saujanya, please unmute,
Yeah.
doctor.
Hello.
Hello.
Yeah, I'll be sharing the screen.
Okay, doctor, please share the screen.
Is it visible?
Yes, doctor, visible, doctor. Please start, doctor. Please start.
Yeah. Good evening. I'll be starting the topic with a comprehensive classical approach towards Pakshaghata and its management. So, understanding the Pakshaghata classically is very important before treating it. It goes on Nirupti. Pakshasya aghatah iti Pakshaghatah. Pakshasya vadaha iti Pakshavadah. That is a condition in which there is aghata or vadha, that is injury to Paksha, which is half of the body, is termed as Pakshaghata or Pakshavadha. So the paribhasha or the deals with Pakshasya dehardhasya ghatam vinashanam yasmat yatrava. So the condition in which half of the body is affected is termed as Pakshaghata. So what is this Pakshaghata? According to different authors, the Acharya Charaka says that Hatvaikam marutah paksham dakshinam pamamevava kuryat cheshta nivrittim hi prujam vakstambham evacha. So due to Nidana Sevana. So what are this Nidana Sevana? There is no specific set of Nidana which has been enumerated for Pakshaghata, where we have to take the Vatavyadi Nidana such as Ruksha Shitalpa Lakhanna Vyavayati Prajagaraihi Vishamadupacharacha Doshastrat Savanadapi Langhana Plavanadhyatha Vyayamati Visheshtitaihi Dhatunam Sanshya Chinta Shokaragati Karshanath and so on. So I'll take an example of Ruksha Ahara Sevana. So increased, excessive and prolonged usage of Ruksha Ahara, for example millets, for a long period of time may lead to Vata Prakopa, where the Sthana Samshaya of Prakavita Vata will take either on right side or left side, either Dakshina or Vama of the body, leading to loss of function in the affected side, pain, and speech disturbances. Whereas Acharya Sushrita gives a different opinion regarding Pakshagata as Adhogama Sapiryaga Dhamani Urdhva Dehagaha Yada Prakupito Atyartham Matarishva Prapadyate Tada Anyatara Pakshasya Sandhibandhan Vimokshayan Antipaksham Tamahuti Pakshaghatam Dishakvaraha Yatsya Kritsnam Sharirartham Akarmanyam Achetanam Tatah Patatyasunvapi Tyajat Anira Piditaha. So again, the Nidana Sevana, Samanya Vata Vyadi Nidana Sevana, Vata Prakopa takes place. There will be Sthana Samshaya of Vata in Adha, Urdhva and Tiriya Dhamani of one side of the body, causing Sandhibandha Vimokshana, which is referred as collided structures distraction, the structures which are united, leading to partial or complete loss of functioning, and partial or complete loss in sensation of the affected side also affects the level of consciousness. Acharya Dalhana says that if there is complete loss of functioning, the person will fall, that is Patatya Suha. If there is complete loss of sensation or consciousness, the person will surely die. So Pakshagata is not a simple condition where we can neglect it, but we have to take a cautious precaution before treating it. So according to Ashtanga Hridayakara, Hitvarthatanor Siraha Snayur Vishoshacha Pakshamanyataram Hanti Sandhibandhan Vimokshayan Kritsnortha Kayastasya Syada Karmanyo Chetanaha Ekanga Rogam Tankechit Anye Pakshavatham Viduhu Sarvanga Rogam Tatvacha Sarvakaya Shritya Nilehe. So again, the Nidana Sevana leading to Vata Dosha Prakopa, Sthana Samshaya in Sira and Snayu of Ardha Sharira, either Dakshina or Vama, Shoshana of Sira and Snayu of the affected side, causing Sandhibandha Vimokshana of affected side, that is distracts the collided structures or structures which are united, leading to loss of functioning and sensation in affected side. According to few authors, Anyaha, it is also termed as Ekangavata, and if Vata affects the whole body, it is termed as Sarvangavata. So, if one Avayava is affected, it is Ekangavata. If Ardha Sharira is affected, it is Pakshavata or Pakshagata, and if Sampurna Sharira is affected, it is called as Sarvangavata. So Pakshagata is a condition wherein either one half of the body will be affected, either partial weakness or complete weakness along with loss of sensations, which also affects the speech disturbances. Moving into Chikitsa, Svedanam Sneha Samyuktam Pakshagate Virechanam, Snehanam Sneha Samyuktam Pakshagate Virechanam. Understanding this is very much important in treating the case of Pakshagata. So Sneha Samyukta Svedana or Svedana and Sneha Samyukta Virechana has to be planned, or Snehana and Sneha Samyukta Virechana has to be planned. For example, Sneha Samyukta Svedana such as Patrapinda Sveda with Ishat Patahara such as Nirgundi Taila, Dhanvantara Taila and so on. Sneha or Svedana, Sagni or Niragni based on the condition. Sneha Samyukta Virechana refers to Virechana either with Nimbamrita Diyaranda Taila, Gandharva Hastadi Taila and so on. So according to Sushrutacharya, he specifically says Pakshagatopadrutam Anamlagatram Sarujam Atmavantam Upakaranavantam Chopakramet. So these are all the conditions to treat a rogi of Pakshagata. Otherwise, there will be a shohani of a physician. Tatra prag eva sneha svedopapannam rudunam shodhanena samshuddhyaha anuvasya asthapya cha yathakalam akshepaka vidhane nupachare. Vaisheshikascha mastikshah shirobhastihi anutailam abhyangarte salvanam upanaharte balatailam anuvasanarte evam atindriya stri saturova masan kriyapatham upasevita. So what does it mean? He explains two chikitsa, Samanya chikitsa and Vishesha chikitsa. Samanya chikitsa initially Hana and Svedana followed by Mridushodhana, that is Virechana. After Vishramakala, this is very important, then Anuvasana and Asthapana Basti should be planned. Either Virechana or Basti based on the condition and Akshepakavat Chikitsa. Vishesha Chikitsa such as Mastishka, Shirobasti, Abhyanga with Tanutaila, Upanaha with Salvana, Balataila for Anuvasana Basti. So this chikitsa should be performed for 1 month, 2 months, 3, 4. How many months? That is months together till the patient attains the normalcy. It is the speciality of Acharya Sushruta and practically applicable in the chikitsa of Pakshagata. So moving into discussion and conclusion, a comprehensive understanding of Pakshagata and its management according to Ayurvedic classics is very much important in the present era. Many unsolvable neurological disorders by contemporary medical science such as CVA, paralysis, etc., which can be taken under the purview of Pakshagata, can be undoubtedly taken up by Ayurvedic physicians if concept of Pakshagata and its management is thoroughly analyzed and understood based on the classics. This is the bibliography. Thank you.
Thank you, Dr. Saujanya. Thank you for the session. And next, I invite Dr. Drakshayani Shanawat. Dr. Drakshayani Shanawat, are you there? And Dr. Sumit Kejanan, are you there? Dr. Sumit Kejanan, are you there? Okay. We have come up to the end of the first day of Tarangini presentation. I would like to invite Dr. Aishwarya RS to conclude the session.
Thank you, Dr. Sabin. So, thus we come up to the end of our today's presentation. And I'm sure that it was a well spent day for each of our participants. And we'll meet tomorrow again. And before that, I would like to express my sincere gratitude to our faculty members. And I congratulate each participant for their wonderful presentation. Thank you all. We'll meet tomorrow.